Welcome, everyone. I will call the meeting to order. We have an agenda before us. Additions, deletions to the agenda. There is one addition to the agenda under 4.2, water. And we also have an addition, 11.1. It's under FOIP, Section 17, harmful personal privacy. Okay, are there any other additions or deletions to the agenda? Seeing as not, I will look for a motion. Yes, Councillor Christie.
I'll move the agenda as amended.
Okay, we have a motion to move the agenda as amended. All those in favor? And that is carried unanimously. We've pre-circulated the minutes of the February 8th regular meeting. Any errors or omissions? Yes, go ahead, Councillor McGee.
If there's no errors, I'd like to move that we approve the minutes of the February 8th council meeting.
Okay, we have a motion to approve the minutes of February 8th as presented. All those in favor? And that is carried. Our first agenda item will be 4.1, proposed recycling bins. Welcome, Mr. McKiernan. Anytime you're ready, John.
Thanks. Good morning, Reeve, members of council. This morning I bring forth an RFD 4.1 agenda item for proposed recycling bins. So as we know, we've been in discussions about the recycling bins or recycling options for a little while. So I'm bringing a part to provide an option for the residents to recycle. So with the closure of the recycling depot within the town of Three Hills, some certain recycling that was being offered has ceased to be available. Some of the recycling options that are no longer offered include plastics, glass, and tin. Council has requested that we do provide some information on the service levels that could fill this void and provide a convenient option for our residents. County administration is proposing that council approve the placement of recycling bins at the Kneehill County Central, at a Kneehill County Central transfer site, and in brackets we have the Three Hills site, for a trial period for 1 year. 2 companies that provide such a service in the area were approached to provide a quote for the service as well as provide information on what is acceptable materials for the bins. As the total expenditure for this trial project is to be expected below the NWPTA limits, this proposal is not required to undergo a request for proposal process. It should be noted that both options are single stream recycling and the bins would be placed among our current cardboard and newsprint recycling bins. Ratepayers will be encouraged to limit the disposal of cardboard and newsprint into these new bins to extend the lifetime between the pickups. So I've listed a couple options. It's not rated in any way, just the way it is. So our first option there is we can have one place 5 front load containers with a capacity of 6 yards. An estimated annual cost of this would be $20,000 based on bi-weekly pickups. The acceptable material in these bins would include plastics, paper, cardboard, tin, and beverage containers. On these ones, it should be noted though that no glass is permitted. Our second option, is for one roll-off bin with a capacity of 30 yards. So just one large bin. The estimated annual costs is about $12,000. This is based on a monthly pickup. This one, like I said, if it's busy, it can be picked up anytime on a call basis. So, but you just increase the costs basically. The acceptable materials in this bin includes plastics, paper, cardboard, tin, beverage containers, and glass. So the addition of these recycle bins to our Kneehill County Central Transfer Site would offer our ratepayers an option for recycling certain materials that have not been previously offered. Being located at a site with other recycling bins would hopefully encourage more separation of the materials. The site would be supervised and would allow the opportunity for education on all our sites and the recycling offered at each of them. The option of entering into a service agreement with a third party will alleviate the need for us to purchase and maintain our own infrastructure to provide this service. It seems with recycling, trends on acceptable items change from time to time, And there is always that possibility that what's acceptable now, today, may not be so in the future. As the recycling bins would be located at our Kneehill County operated site, an attendant would already be present and operating hours are already established, resulting in no additional staffing requirements. It should be noted that if the hours of the site were to be changed to accommodate greater access to the bins, that staffing requirements may need to be evaluated. As this is an emergent request by council, funding of this pilot project was not included in the 2022 proposed operating budget and would require an amendment as such. A one-year service agreement would be implemented, resulting in a financial commitment for that term at the minimum. So some of the council options would be to accept entering into a service agreement with a third-party contractor to supply recycle bins at our Kneehill County Central Transfer Site, to reject entering into a service agreement with a third-party contractor to supply recycle bins at our Kneehill County Central Site, defer consideration and consider within the 2022 operating budget deliberations, or that council receives as information. And just to follow up, when whatever council decides, we would then follow up with information sent out to our ratepayers through the website, through social media, through newspapers and all that. So we would make it readily, hopefully as much known as we could out to them if we do go ahead with it.
Okay, thanks, Mr. McKiernan. Are there any questions from council for Mr. McKiernan? Yes, Councillor Penner.
Morning, John. Option number 2, is that a commingle? It's just one bin for everything?
Through the Reeve, yes, Councillor Perrin, that's for both of them would be single stream, so commingle, same idea. Yep.
Councillor McGee.
Also for option 2, if they were to need to pick up bi-weekly, how much of an upcharge would that be about?
Through the Reeve, Councillor McGee, you would probably, if they were coming twice a month, then you'd probably double that. Yeah, so the costs are fairly similar, but it would all depend on how busy we become with that, right? So.
Any other questions? Yes, Councillor Christie.
The single bin, would it be in Torrington then or in Three Hills?
Through the Reeve, Councillor Christie, we would are proposing that they would be at the Three Hills transfer site. The reason why is the last recycle depot was located in Three Hills and people found that convenient. So our Three Hills site is just another kilometer outside town. So in my mind, it would still be a convenient option.
Well, it was more convenient than Torrington. I don't hate to put Torrington out, but Trochu's, or I'm sorry, Three Hills is way more central. So.
Councillor Penner.
So even though these bins can take cardboard too, we would still encourage them to use the existing cardboard bins? Is that correct?
Through the Reeve, Councillor Penner, that's correct. Yeah, we would. We'd put them in the same area, and then the attendant would be like cardboard here, your other material here. So we'd definitely encourage it. So we limit the amount of pickups, hopefully, that we would have to get, so we don't fill it with cardboard.
Deputy Reeve King.
So just a couple of questions, John. So currently we're taking newsprint and cardboard at our site at Three Hills. Have we had difficulties with those in terms of people putting appropriate product in there or not?
Through the Reeve, Deputy Reeve King, we do take both of those at our Three Hills site, both newsprint and cardboard. No, we've actually had pretty good success with the cardboard. We have seen a bit of uptick in the amount of material we've been receiving in the last month or so, but no, we have people are fairly good with the cardboard and newsprint.
Go ahead, Deputy Reeve King.
Okay, so this just more kind of like a follow-up on what Councillor Penner asked is then in our promotion of this recycling, would we, in the materials that we put out, we would then be encouraging people to try to keep the newsprint and cardboard separate from the rest of their recycling, and then encourage them to go in the single stream with the other materials?
Through the Reeve, Deputy Reeve King, that'd be correct. That's how I would word it out there, is that we now have a bin for plastics and glass and tin and all that sort of thing, and then still offer our bins for cardboard and newsprint as well. because those are separate as well, right? I mean, the cardboard and newsprint are done through our Drumheller Solid Waste. So that's a whole different contract. This would be separate outside of that. So this was just between the county and the third party. So we would definitely, through our wording, would direct people to separate still.
Yeah, go ahead.
So we're looking at a one-year contract. Our hours at the transfer site right now are Tuesday, Thursdays, 10 to 6, and Saturday. So those are the days that they'd be available.
That's right, through the reef. Tuesdays and Thursdays, 10 to 6, and Saturdays are 9 to 5. And yeah, so they'd be available during those times.
Just a question, Mr. McKiernan, plastics, all plastic, or is there specific, because there's all sorts of different numbers on different containers?
Right.
How do you,
So through the reef, so that is true. So they only take the plastics, the numbered plastics 1 through 7. So like those little clam shells and things like that, and styrofoam, that kind of stuff is not acceptable material. We'll put that out there as part of our education. With the cost that we're paying, you do pay a certain amount for tipping fees, and that includes for situations where they have to separate out that unwanted material. So, and I think that it goes from basically, I think it was $100 or $125 a metric ton, and you can go up to like $300 and some metric ton. So in the quote, I used the highest one, and that depends on the volume of contamination. So I factored in that contamination into your costs.
okay, so I imagine we're gonna have more signs?
Through the reef, yeah, we'll have sign probably up by the bin to say what's acceptable and stuff, yeah.
All right.
Why not?
I think it's important to, I don't know, it's important to know what can be recycled and what can't be. But you gotta know before you get there. So that'll have to be out on the website someplace, because and maybe something to the effect that if the bins become contaminated, it costs more, that the option may disappear. I don't know how you'd word it, but.
Yeah, through the reef, we do, the companies do provide diagrams now, like actually pictorials of what is offered, so that would be all part of the information that we get out there, so.
All righty, no couches.
Pardon? No
No
couches?
couches.
No.
Okay, what are council's wishes? Yes, Councillor McGee.
I have one more question before
Oh, yeah,
our
go
motion
ahead.
gets on the floor. Between the two options, the only difference basically is whether we take glass or not. As far as the work for our staff to deal with it, does that make a difference, either option? Is there any other reasons, yes or no, for one or the other?
Through the reef, Councillor McGee, that's right. The only difference is the size of bins, and that one will take glass and one will not. But for our staff, they're still there, so, they'll do what they normally do during the day.
Councillor Penner.
I know with sites within Drumheller Solid Waste Association, if you don't put a barrel next to the recycling or whatever for the product that can't be accepted, like clamshells or glass, it does get into the wrong container, even though there's staff there, it just happens. And I think if we do go with one, we almost should offer a bag there, you know what I mean? Because people won't walk up the hill or at that site. It might be a little bit more work for the staff that are there. But it's just what we've seen with Drumheller Solid Waste. For those products periodically that cannot be accepted, they get in there. So we've put a barrel, just an oil barrel.
To the reef, yeah, that's a good option for sure. We can definitely institute that for sure.
You mean they don't take it home with them? Yeah.
Exactly.
Yes, Deputy Reeve King.
So in my conversation with ratepayers, glass has always been part of that conversation. So I think I would, if I had a choice, I think I would prefer that we're going to take glass. Seems like people save that as well as the other materials that they're saving, and they really would like to see an option for that. So, having said that, I'm willing to make the motion that we accept entering into a service agreement with a third-party contractor. I'm suggesting option 2, to supply recycle bins at our Kneehill Central transfer site. That's my motion.
All righty. Is that up on screen? Yes, it is, I think. Okay, so we have a motion before us. The council, well, I'll wait for you to. I'll wait for you to trip me up here. Okay, so so we have a motion before us. The council approves option 2 in the 2022 operating budget and directs administration to provide recycling bin at Kneehill County Central Transfer Site for the purpose of a 1-year project. Is there any discussion to that motion? Yes, Councillor Penner.
I want to thank your department, John, for bringing this forward as a third party, rather than bring it back to us to purchase them, because with the new extended producer responsibility, the EPR that's happening, the unknown, and it'd be unfortunate to put money out and then the government doesn't go with that program. So thank you for bringing this option, this trial forward here now, and hopefully in a year, we may know more about the extended producer responsibility.
Is there any other discussion? Yes, Mr. Hogan.
Thank you, Mr. Reeve. Just wanting to not comment on the item itself, but just a process clarification. I think council's aware, but just in case not, because it's really the first one of these that you've done as a new council, but the prior approval mechanism, you're working on an interim budget right now. We've got the deliberations for the fully approved or the final 2022 budget ongoing. So by granting prior approval, what you as council are telling admin is that this is an approved item to move forward with. So I just wanted to provide that little clarification for anybody listening or for any member of council, is that once you approve this, administration will be moving forward on it, even though it's a 22 expense, because you've approved it prior to the full budget approval. So there's just a little nuance there, is that you're not directing us to include this in the 2022 budget, although we will, because you're approving it today so that we can move forward with it today. Right, so there's a little nuance there that I wanted to make clear for anybody, any member of council or anybody looking at, and that's what the prior approval is.
Deputy Reeve King.
My comment would be is that based on the feedback that I've gotten, people want this to happen sooner rather than later. And you're probably, based on the amount of material I'm being reported stored in garages, sheds, and other places, you might have a few frequent pickups at the beginning. But my ratepayers are anxious for this to take place, and so I'm very happy to see this being presented today and for us as council to make a decision and move on this.
Is there any other discussion to the motion?
Reeve, if I could just make one little comment, just to
Sure,
make sure.
go ahead, Mr. McKiernan.
We're going with the glass one because that's what people are wanting, but the glass is kind of the contentious part of all the recycling. So just to be aware that that might be the one that might fall off the side. There could be changes. I just wanted to make sure that you're aware, so you're not approving that expecting it, because it could change and we don't have control over that.
Well,
Go ahead, Councillor.
I think that ratepayers in general would like to have an option for glass. They also realize that it is one of the ones that's difficult. And so if something was to change, I think that would be not unexpected. But if there is an option to give them glass at this point, I think we should grab it. Thank you.
Guess my comment to that is there is an option for glass. But won't go any further than that. Is there any other discussion to the motion? Seeing as not, I will call the question. All those in favor? And that's carried unanimously. Thank you. Our next agenda item is 4.2, water policy. Mr. Hogan.
Thank you, Mr. Reeve. To you and council, this item was put on the agenda this morning, just given an event that occurred after the agenda was finalized in its previous form. We've one of our ratepayers had a maintenance issue, a rather large one, recently, and they've inquired if the county can increase flows to provide water while they're undertaking repairs. Administratively, given the temporary nature of the increase, given our ability to help that ratepayer, we made the decision on an emergency basis, an emergency for them, not for us, to increase the flow rate. Normally this falls under policy, I believe, 1415, and increasing the flow rate requires a formal motion from council. However, that policy contemplates that on a more permanent basis rather than on a temporary emergency basis. So there's a little bit of gray area within the policy. We made a call late last week to assist, and we're just looking for council's endorsement or the formal the formal approval of a temporary flow increase for that ratepayer so that they can maintain operations while they're conducting repairs.
Thank you, Mr. Hogan. I do believe there was an engineering report done, and the integrity of the system will be maintained for the balance of the users.
Through you, Mr. Reeve, to council, it's one of the concerns that the administration has been monitoring, is making sure that any rate increase or any flow increases that we do are not going to adversely impact the remainder of the system.
Okay, very good then. Are there any questions from council to Mr. Hogan? Yes, go ahead, Councillor Forbes.
Just wondering how long they estimate the time for the repairs.
Welcome back, Mr. McKiernan. Long time no see.
So through the Reeve, Councillor Forbes, they are, from the last time I spoke to them, they didn't really have a definite timeline, but they're thinking 4 weeks. Basically, they blew out an RO unit, which is probably got it delivered, reset up and everything. So there's a little bit of work to be done. So maybe 4 weeks, I think.
Are there any other questions? Yes, Councillor Cunningham.
Can we confirm that there'll be no adverse effects on residents in the area as to their water availability due to the increase to this project?
Sure. So through the Reeve, Councillor Cunningham. So we did contact our consultant, and they did run like a model on it, and it does show that they can get extra flow, increased flow. There is some spots in the southwest of it that kind of shows a little bit of potential lower pressures. So that's something that we can make sure that we're monitoring and stuff like that. So there are some areas that they identified to us that we'll kind of keep our eye on. But the one good thing, I guess, is that system, we're not running at 100% capacity. So we have the pump capacity, we have all that kind of, so we're in a pretty good situation to help out.
I guess as one of the people that live in that southwest end of the county, haven't noticed anything with our water at our place. So, yes, Deputy Reeve King.
I understood that we also provided them with a bulk water access, and are they using that option or not?
So through the Deputy Reeve King, we set them up with a bulk water account. From what I was told this morning from the operators, that they were using it quite a bit through the weekend. I think on Sunday it slowed down, but I'm going to guess maybe that's because they had their tank full and they can go, I think it's a few days on that capacity. So maybe they'll start back up again here in the next day or two. But yeah, it's available to them, and it was an option.
Go ahead, Deputy Reeve King.
So if they're using that option, that does take some pressure off the line itself, correct?
Through the Reeve, yeah, that's right, Deputy Reeve King, it would. When you look at the flow that they can get, though, they're probably not getting as much as they really need from ours, because we do have the 2-inch lines, but then once you get the service connection in, you're going down, like, I mean, our meter's a 3/4-inch meter, right? So now you're restricting the flow through that as well. So they're not getting as much as what they could potentially get, but they're getting more than what we can usually give.
Is there any other questions from council? Yes, go ahead, Councillor McGee.
We want to be a viable community, and so that means stepping up at times when we don't expect to. And so I'd like to make the motion that we authorize administration to temporarily increase the flow to Sunterra Greenhouse until repairs are completed.
Okay, thank you very much. We have a motion before us to authorize administration to temporarily increase the flow rate. Is there any discussion to that motion? Yes, Councillor Cunningham.
I'm just wondering, do we want to put any kind of a time frame on that? Because it's quite vague, like temporarily, until repair is completed. Like, I'm just wondering, that's leaving it pretty, that could be a month, it could be 2 months. Like, I'm just curious whether we want to put a time limit on that.
If we do put a time limit on it, they would have to come back before us if they weren't ready to use or re-engage the old system.
That's correct.
Councillor Penner.
I'm not sure if it's necessary to put that on there because, like you stated, we're not at the max, and being the season we're in right now, it's not the spraying season or whatever with our bulk systems. So just my feeling is I don't think it's necessary right now because they are working to get it fixed and they want it fixed to go back to their own ASAP. So I think I just wish them the best and hopefully it's not very long.
Is there any other discussion to the motion? Yes, Councillor Christie.
There's no water restriction on a commercial account or a, what do you call it, a bulk water account. You can draw what you need. There's no volume restriction on that account.
Through the Reeve, Councillor Christie, there isn't per se, but we do have it in there. So if you're taking a whole bunch of water from our reservoir, we actually have a level where we cut off the bulk water sales so we can maintain our system. So it's just until it recharges, then it's open up again. So not a per person one, but a system side one. Yeah.
Thank you.
Are there any other questions or discussion to the motion? Seeing as not, I will call the question. Okay, so the motion reads, Council authorize administration to temporarily increase the water flows until repairs have been completed. All those in favor? And that is carried unanimously. Thank you, Mr. McKiernan. Mr. Hogan. We have a delegation for 9. I do believe you're running a little bit late. So, yeah, not blaming you, Scott. So we'll just continue on with our agenda. Our next agenda item would be 5.3.1, annual appointment of fire guardians. Welcome, Ms. Grosfield. And anytime you're ready, Deb.
Thank you, Council. Good morning. I bring to you today the annual appointment of fire guardians. The recommended motion is that Council appoint the fire guardians as listed. And then further to their appointment, that if they are off the respective fire department, then they would leave that position and that appointment would be revoked. So relevant legislation, provincially, this is under the Forest and Prairie Protection Act, Section 4, requires that each year the council of a municipal district shall appoint for a term not exceeding 1 year with effect from the beginning of April, a sufficient number of fire guardians to enforce the act within the boundaries of the MD, except the part of the MD that is under the forest protection area. The Forest Prairie and Protection Act also states that the chief elected official, each councillor, and the CAO are, by virtue of their offices, fire guardians in and for the municipal district, except the part of the MD that's part of a forest protection area. We also have a bylaw, our fire protection bylaw number 1770, that states that council will appoint fire guardians to carry out the roles and responsibilities of the bylaw, and fire guardians and permitting details are in the bylaw as well. Background, the appointments have been recommended by each of the district fire chiefs to the CAO designate. Administrative staff can issue fire permits should a volunteer department member not be available. Because this is deemed an administrative function, we ask that council doesn't act on being a fire guardian, just because you don't have access to that fire permitting system. Discussion and options. Fire permits are issued by fire guardians throughout the year to maintain control of burning throughout the county. Last year we had 370 permits that were issued. That is down a lot because of the dry year and because of the extended fire ban that we had on for most of the summer last year. So usually it's around 500 permits that they issue. The advantage of having all districts with permitting access allows for administrative weight to be balanced, and the advantage of permitting to be completed by each district allows for fire department and dispatch notification and approvals for burns that are specific to that area. Financial and staffing implications. Fire guardians are appointed through our council. However, they are compensated through their own municipality if deemed necessary. Our customer service have helped many ratepayers with the online system if necessary. Information technology and records management maintain the user accounts for that fire permitting system. No further financial or staffing implications. And council options are to appoint fire guardians as recommended to March 31st, 2023, to amend the fire guardian appointments, or to have administration research further options for council's consideration.
Okay, thank you, Ms. Grosfield. Are there any questions from council to Ms. Grosfield? Councillor Christie.
I'm just curious, why do the majority have 3 and 2 have 5?
Through the chair, we leave it up to them to decide, just because some of them might be working out of, it just works with them better, just so they have coverage to be able to actually permit those and go through that administrative process.
Okay, thank you.
Any other questions from council? Deputy Reeve King.
So I'm not going to read the list of names, but I will make the motion that council appoint as fire guardians for the issuance of fire permits for March 31st to March 31st, 2023, the people listed in the motion, and further, should any of the appointed fire guardians leave their respective fire departments or leave their position at Kneehill County, their appointment will be automatically revoked.
Okay, thank you very much. We have a motion before us as printed on screen, because I'm not going to read all the names either. Is there any discussion to that motion? Seeing as not, I'll call the question. All those in favor? And that is carried unanimously. All right, next agenda item 5.3.2, policy review 4-1. Anytime you're ready, Ms. Grosfield.
Thank you, council. So today we're doing a regular policy review. This is policy number 4.1, use of equipment, which is for fire. And we believe that it no longer applies. The background to this, so the recommended motion is to delete the policy as it no longer applies. The background to this, at the September 9th, 2015 council meeting, all policies on fire were reviewed, and policy 4.1, use of equipment fire, was changed to the policy attached. The intent of this policy is to regulate the permission granted to take Kneehill County fire equipment outside of regular firefighting purposes. There's some sections in the bylaw, but the one that, section 7.1 limits the limits of the jurisdiction of the services will extend to the area and boundaries of Kneehill County, and no part of the fire apparatus or service shall be used beyond the limits of the county without the express written authority or mutual aid agreement providing the supply of firefighting services or other incident response outside the county boundaries. The CAO may authorize the service or any portion of it to assist neighboring communities who may be experiencing an emergency. So we believe that that already covers this part of this policy. Fire sub-agreements have also been made with each urban partner regarding the provision of fire services. In these agreements, shared ownership of most engines and some other equipment is defined. And so we might actually need to, because it's shared ownership now, we would actually maybe even need to have that other CAO also approve it. So anyway, so that's kind of an operational manner, and all operational matters are to be resolved between the fire chiefs, and then it would escalate up to the CAOs if necessary. So an example of this is sometimes, like for the Slave Lake fire example, they were looking for equipment to come up there, wildfire interface equipment and structural equipment to go up to Slave Lake. And so they put out a call to all these fire departments, and there was a whole bunch of people that were self-responding to those fires, and we said no. Like, that was too far, and we couldn't afford to have that equipment out of our fire service. So at the time, that's kind of where we were at, and we also didn't have trained members in wildfire urban interface firefighting. So that was kind of part and parcel of that decision. So discussion options. So the benefit to keeping this policy is unknown, as we figure it is redundant. We are currently reviewing the fire protection bylaw and may add further clarification should council see that as being necessary. And consultation has been completed with the Fire Chiefs Committee on January 24th, 2022, and no further comments were made about this policy. No further financial implication and no staffing implications in regards to removing this policy. And the policy is attached, and council's options are to delete the policy, to amend the policy, or to have administration research further options.
Okay, thank you. Are there any questions from council for Ms. Grosfield? I guess I'll just add a little information. The reason I do believe that policy was brought in, and like you've stated, Ms. Grosfield, we didn't go to the Slave Lake, but we did go to BC. And that's where the problem came in, because we as Kneehill County weren't aware that we were sending our equipment there. A little communication would have helped at the time. But that's the reason for the policy. Any other? Yes. Councillor Penner.
Seeing no more discussion, I would make the motion that council rescind policy 4-1, use of fire equipment.
All righty, we have a motion before us to rescind policy 4-1. Is there any discussion to that motion? Seeing as not, I'll call the question. All those in favor? And that's carried unanimously. We're on a roll here. Next agenda item, 5.3.3, policing priorities. Welcome back.
Oh, me again. Thank you, council. This RFD is on council policing of priorities for our community. So the recommended motion is that council approve the new 2022 policing priorities for Kneehill County community as discussed. And I'll let you choose those priorities throughout here. So the background proposal is that Kneehill County has 5 RCMP detachments serving our area: Three Hills, Innisfil, Drumheller, Bicycle, and Olds. And the map is there. Innisfil's area is very tiny. We do receive the quarterly reports, and we've put them into one RFD for council to look at those. To ensure they are providing quality service to our local authority, our CMP detachments are requesting input from our councils on their community priorities so that they're reflected in their service plans. And so then they can report back to council on specific service plans. Our CMP generally serve our communities with the focus of administration of justice, preservation of peace, and prevention of crime and enforcement of bylaws and laws, sorry. The benefit of setting these priorities is to focus our CMP reporting specific to Kneehill County community. Acme, Carbon, Linden, Trochu, and Three Hills will have their own community priorities that they'll be communicating with their respective RCMP detachments that serve them. In 2021, Council set Kneehill County's 5 community priorities in no order: rural crime prevention, enforcement, and education. So staffing complements. So Council wanted to know how many officers or if there was changes in the officers in our area. Presence in rural communities, building relationships and partnerships, road safety, and then working with our community peace officers and delivering enforcement and public safety education. Other priority considerations, working with rural crime groups in our area, community safety through programming, and enforcement of municipal bylaws, which they do help with, regional outreach with partners to facilitate collaboration, presence at rural facilities, and other as per Council's direction. There are no further financing costs, and the province has implemented a payment schedule for policing costs to each municipality, and this has been included in our operating budget. These amounts have also been reflected in our 5-year plan. There are no additional staffing implications. Our community peace officers work with our CMP detachments on numerous JFOs, Joint Force Operations. So council options are to approve the same 2021 policing priorities for Kneehill County community, or to amend those policing priorities, or for council to do some more research and bring you back some more options.
Does council have any questions for Ms. Grosfield? Well, if you're off the hook, I'll put the council on the hook. What would you like to see the priorities be? Councillor McGee.
I've seen lots of good work being done in the areas that we made as priorities, and I also think they will remain to be an issue for the next while still. So I would like to just set the same priorities as 2021. That would be my motion. I just, sorry, I should have brought it up.
Okay, we have a motion before us.
Approve the new 2022 policing priorities for Kneehill County as listed in 2021.
Councillor Christie.
Just a comment that I appreciate the better information feedback we've had the last couple of years, so I appreciate what this may be doing, so I appreciate that.
Is there any other discussion to the motion? I guess my comment would be is the RCMP have done a considerably better job than what they used to do as far as listening to our residents. So I'm in agreement with that motion. Councillor Penner.
I just want to throw it out there. I would like to see the community safety through programs and workshop moved up, just to be seen. And the staffing complement, to me, isn't a high priority right now. I think we have a relationship in my books with them, through your staff and through our peace officers, that they will continue to let us know if there's a shortage and whatnot else. And I know it's a priority, we want them in the building and whatnot else, but do we need to know the change? I'd just like to see them out in the different events with the community safety through the programs and workshops. Just a discussion item.
So you would be moving that as an amendment?
Can we have a discussion before an amendment? Tell me why I don't want to go that way.
Well, we have a motion on the floor, so I'm just, Mr. Hogan, clear up the fuzziness for me.
You've got, you're on the right track, Mr. Reeve, you have a motion out there on the floor. So if you're looking to change that motion, then you're looking at either whether that's a friendly amendment or to vote on a change to that motion if it's not.
Councillor Penner.
We can leave it the same. I mean, when you read through all 5 of them, there is to do with rural communities and whatnot else. So we can leave the motion as is.
Did not mean to intimidate by any means. Yes, Deputy Reeve King.
Okay, I'm going to step in on this one, and I think that really what Councillor Penner is asking for is not that we ignore the staffing complements. So I think that you could easily switch and drop the staffing complements into other priority considerations and move community safety through programs and workshops up. So I'm going to make that amendment to the motion to suggest that we shuffle those community priorities. And I like that reflection of higher presence in the communities and supporting those communities through safety programs and other workshops. So my amendment would be that we drop the staffing complements to other priorities and move up community safety through programs and workshops into our top 5.
Councillor McGee, would you see that as a friendly amendment?
Absolutely, I fully agree.
Okay, so if that's a friendly amendment, we do not have to vote on the amendment. So now the motion has changed to reflect that staffing complement be moved down and community safety through programs and workshops be moved up. Is that how we're seeing the motion?
If I may, Mr. Reeve, I think what we would do for Carolyn as well, the motion would be best served as if we just listed the 5. And we can do that if council knows that's what we're voting on. We can, Carolyn and I can work on the wording of that. But that way, rather than saying change this, change that, if we just list what the 5 are, then it's very clear what the 5 are.
Good. So we have a motion before us with 5 items. Council knows what those 5 items are. Is there any discussion to that motion? Deputy Reeve King.
And I'm interpreting from what Councillor Penner said, but I think that one of the things that we really have appreciated about what's happening with the RCMP is their increased presence in our communities and that increased visibility. And in my mind, changing that one priority just increases that visibility and presence. And I think our residents is, like the people who live in our communities, will appreciate that higher visibility and that higher level of presence in their community. So.
Okay, thank you. Is there any other discussion to the motion? Seeing as not, I will call the question. I'm not going to read out the motion, but it is printed in front of us. So all those in favor? And that is carried unanimously. Okay, thank you very much. It's 9:19. Shall we take a break, recess? And we will come back, hopefully, with the EMS presentation at whatever time. Okay, we're in recess. Okay, I will bring the meeting back to order. Our next presentation, delegation presentation, Alberta AHS, and I see our Mr. Hine has arrived, so if you're ready to go, Mr. Holsworth, what we'll do
believe I'm
is
ready. I
we'll
think
first
he is as
introduce
well.
ourselves,
Please.
and then you guys can introduce yourselves. So starting from my far right,
Division 4, Carrie Phobes.
Division 5, Laura Lee Michelle Cunningham.
Morning, gentlemen. Debbie Penna, Division 2.
morning, Jerry Whitstock, the Acme Linden area.
Good morning, Ken King. I represent Trochu and north and east of Trochu. Well, I don't represent Trochu, sorry, Trochu area, north and east.
Wade Christie, and I'm in the northwest corner of the county.
Faye McKee. I'm Division 1, down and around Drumheller area in Horseshoe Canyon.
And we have Mr. Hogan, our CAO, present with us, and you guys want to introduce yourselves. If you want to tell a little story about yourselves, go ahead, but
Good morning. My name is John Hine. I'm a paramedic strategist with Alberta Health Services, and I'm involved with Medical First Response, or MFR. I provide support to all the fire departments when they go on medical calls.
Good morning. Thank you for having us. My name is Scott Holsworth. I'm the EMS Operations Director for the Central Zone. I've had a few questions asked to me already this morning. Brian is my brother. He's down in Mexico right now, but he was, of course, on council for a number of years. I grew up in the Carbon area for most of my schooling days anyway, so I'm familiar with the area. I've been around. Currently, I live in Sedgwick, which is part of Flagstaff County, northeast of here, obviously. So, but again, thank you for having us, and happy to present today, and any questions that we can take away from today as well, or have today.
okay, well, thanks, and anytime you're ready.
Okay. I'll go ahead, John, with mine. And good. So everybody can see this on your own screens, correct?
Yep.
Okay, so good. Again, thanks for having both myself and John today. This is a presentation that we try and have very similar as we go out and meet various councils. So it's a look of the whole calendar year of 2021. So when we talk about quarters, it is the actual calendar quarters that we talked about. So for the presentation today, sharing information about EMS, as I had mentioned, addressing concerns from our stakeholders, anything that you can bring to us today, as well as looking for opportunities for improvement. So the objectives of the presentation today, goals, which we just spoke about, the EMS resources here in Kneehill County when it comes to EMS, call volume for the Kneehill County, EMS ambulances serving Kneehill County, communities and areas served by Three Hills and Linden ambulances, transport destinations and EMS response times, current challenges that we're up against and the mitigation strategies around that, and then, of course, any discussions or questions that you may have. Pardon me. So here in Kneehill County, here in the Three Hills, we have one advanced life support ambulance 24/7. We have another ambulance 12 hours a day, or what we would call a peak ambulance, 7 days a week. As well, we have one ALS ambulance in Linden 24/7. Support systems here in the area, obviously Three Hills Health Center, MFR program, which John represents, our air ambulance support response, including STARS. And just a note here, a number of AEDs or community AEDs that we have noted in the county are 14 in the county, Linden, and Three Hills. So, pardon me, EMS volume in Kneehill County. So again, this is from January to December of 2021. You can see the number of quarters there. Again, keeping in mind, this is simply numbers for the county. So any of the rural events that we've had, not necessarily the towns or villages that you have in the county. So of total for the year, 253. Broken out as you can see it. Blue is the emergency calls, so those are the ones that come through 911. Orange are transfers, or inter-facility transfers that we would call IFTs. The green is non-emergency, so those are those very low acuity, not necessarily 911 events. And then The gray is other, so those are our fire standbys. Those are our special events that we may attend from time to time, those sorts of things. So there's a bit of a breakdown for each of the quarters for 2021 that we attended. So the next slide that I have also is just representing in a different way, again, the events just within the county or the rural area of the county. So the services doing the work, Three Hills, the ambulance is out of Three Hills for a majority of the work that's being done, especially on the emergency events. Of course, Linden, Drumheller, which of course you are adjacent to. They have 2 ambulances down there as well. And then the odd time throughout the year, we had seen Olds do some work here in the county, Hannah, Sundre, and so on. You can see the number of services there as it goes down the list. Is there any questions that I can answer regarding Kneehill County before I go into a little bit more detail of the towns? Good so far? So here's a breakdown of the work, EMS work that is done by our Linden unit. So you can see, again, the same time frames or same quarters throughout last year. You can see the spike going up from January up until the third quarter, and then it comes back down a little bit. But a number of those are transfers, as well as the emerge calls are going to be the vast majority of the work that all services do. Next, we'll see the Three Hills unit and the work that they're doing. So again, a number of calls, and this is all of the work that those services do, not necessarily in Kneehill, and we'll look at those slides next, and not necessarily just within Kneehill. So this is the work that they're doing. So the community is served by Linden. As you can see, Calgary, 397. They've done a lot of work in Calgary over the last year. Red Deer, 140, where a majority of those are transfers to and from. Three Hills, 140 as well. Drumheller, 138. Again, the orange, vast majority of the transfers there. And then here within the county, 69. And then it goes into smaller numbers. I only listed sort of the top 6. I'm happy to discuss further if you would like. And then here's the same breakout for Three Hills and the work that the units stationed here in Three Hills are doing. So again, 690 responses, mostly in Three Hills, and most of those are transfers. Drumheller, 213. Again, transfers are a big piece of that. Red Deer, Calgary, Kneehill County, and then some events in Trochu as well. Transport destinations, so these are where the ambulances that are working, that are stationed here in Kneehill, where they're transporting to. And again, I'm not sure why it's sorted the way that it did. My apologies for that. But the biggest number is obviously Calgary, about midway down. Three Hills, Red Deer, and then it goes in, again, the Drumheller piece, Old. So those are that's where the work is they're being sent for to transport, whether it be for transfers or emergency events. And then again, the same thing for Three Hills, which we see a large number of the transports to here and to the hospital in Three Hills. And then the next with Red Deer, of course, with Emerge, and a lot of the DI appointments I would expect would go there. Response times here in the county, we break it down, as you noticed there, both to the 50th percentile and the 90th percentile. As you see in the notes below, 50th percentile is basically if there's 5 minutes allocated to an event, half of the responses are less than that, and half of the responses are more than that. So for Linden, the 50th percentile is 5 minutes and 53 seconds. So again, those half of those below, half of those above. And then the 90th at 28 minutes. Keep in mind that with this slide that you can see, it only looks at what we call delta and echo events, so the very high acuity cardiac arrest, respiratory arrest. And when you have numbers that are quite low, it only takes 2 or 3 extended responses to balloon that. So I don't, The 50th is more what we go by, but obviously the 90th is there, that we had a couple of responses that were quite high. Three Hills being 6 minutes, 17 seconds on the 50th percentile and 11 minutes and 46 seconds on the 90th. And then Trochu, of course, without an ambulance in community, 12 hours, 29 seconds for the 50th, 15 minutes, 17 seconds for the 90th. So our current challenges within EMS throughout the province: increased event volume. Seeing lots of increases, mostly in the metros, Edmonton and Calgary, not so much in the rurals, but the impacts from those increases we're seeing is from that. Prolonged hospital waits, we know that Red Deer, especially for us in the central zone, is quite bad. And I know they're working on that. They're trying to do the best they can to improve the patient flow in that facility. Fatigue management or hours of work, and I'll speak to that in a minute because that's part of the project that the chief spoke to here a number of weeks ago. Suburban rural resources coming into the city and being pulled into the city, we call it the vortex, for lack of a better term, because they do get pulled in there. They do a transport to there, and then they somewhat get stuck in the city. So we'll speak to that a little bit more as well. And then staffing challenges that we're dealing with on a day-to-day basis, whether it be from COVID, from the mandatory vaccination requirement of our employer. These all sort of become pieces when it comes to staffing challenges that we deal with on a day-to-day basis, especially over the last 6 to 8 months. Next slide talks about the 10-point plan, and again, the chief spoke to this a number of weeks ago. I believe it likely stemmed from a lot of the discussion at the Rural Municipalities Association that you attended, and I think they gathered a number of information pieces and brought it back to form part of this plan. But the first one, hiring paramedics. We're engaging the institutions throughout the province to put out or to plan to have more classes around both advanced care paramedics and primary care paramedics. So that's something that's ongoing now because there simply isn't enough out there, it seems right now. Non-emergency IFT pilots. So 2 pilots ongoing right now, one at the Peter Lougheed in Calgary and one in the North Zone, where they're looking at when somebody is transported from a facility, do they truly need an ambulance? Can they go by a community handy van? Can they go by a taxi? Can they go by a family member or private vehicle? So a lot of focus on that right now to make sure that we're using the right modality or transport. Fatigue management, this is a project, we call it fatigue management, some call it hours of work, and that's really how it started. And it was looking at different communities and making sure that we have the right number of resources at the right time of the day that we need them. So when we look at the changes that are coming, and we do have some pretty big ones in and around Red Deer for this central zone, we need more during the day and not maybe so much at night. So they're having what they call, I mentioned we have a peak load ambulance here in Three Hills. They're calling it demand load. It's the same thing, but they're saying, you know, if the bulk of the work in Lacombe, Alberta is between 10 and 10 p.m., 10 a.m. and 10 p.m., that's when an ambulance should be added to the system. So they're really looking at those sorts, it's sort of a non-traditional way of looking at it. Right now we work either 12 hours or 24 hours for a core flex. This is going away from that to a 10-hour day or an 8-hour day, just to make sure that there's enough ambulances in the system to do the work. Low priority calls. So this is something that we're seeing mostly again in Edmonton and Calgary, but when somebody phones up that maybe doesn't necessarily need an ambulance on an emergency basis, they'll route that call to 811 or that information center or to the poison control center to have more discussion there. To avoid sending an ambulance to again, those low acuity calls that maybe don't need an ambulance, just need a ride. Non-injury MVCs, what's been done in the past, as soon as there has been a motor vehicle collision, they've been auto-dispatched. An ambulance has been to those events, and now we're making sure that there's injuries that require an ambulance before we automatically send. Evaluation of the closest, most appropriate. This is really impactful as we talk about sort of that vortex that we see of our rural resources going into the cities. Because this will really make sure that the right ambulance is going. Nobody can can dispute that if the ambulance from Three Hills is going by Airdrie and there's a cardiac arrest at Iron Creek, or the mall, that ambulance should go and initiate that care. But if it's lesser, then this is where the dispatch needs to determine, is it most appropriate that that ambulance go, or is it more appropriate that ambulance get back to its community that it belongs? So this is a piece that dispatch is working through right now. They've just started an initiative to do that about 2 weeks ago, with really big changes that we're seeing in those numbers of those rural resources being held in the cities because of that alone, but there's lots of work going around that. Ambulance preempt and divert is the other one that they're calling. So this is, again, maybe a resource in Calgary going to a fall or a fracture that's, you know, relatively stable, but yet a cardiac arrest comes in and that ambulance is closest. They're going to be diverted to that higher acuity call to make sure that, again, care is sent to the highest emergent need that's possible. Red Deer IFT corridor project, we know, again, I had mentioned that there's a lot of patient flow issues that they experience in Red Deer. A lot of times they need to be able to move patients from the upper floors to create room for those in emergency to go up and so on. It's a cycle, so it's not always just a problem with emerge. It's a problem freeing up beds so those emerge patients can go up to the higher floors. So they're looking at a dedicated IFT service in Red Deer. We're not sure if it's yet going to be contracted or a direct delivery service, but that's solely what they'll do, is move patients, whether it be from Three Hills to Red Deer, vice versa, out to Rocky. Really, that dedicated service, so we don't start to pull the ambulances from the communities, and they'll be able to better coordinate the need for those services and sort of keep ambulances aside for the emerge calls. Strategic Provincial Service Plan. This is a 5 to 10 year plan that's being developed. This dovetails in with the advisory committee that's recently been announced by the chief as well, or by Health, I guess, Alberta Health, that they're looking to review what that plan looks like for the next 5 to 10 years for EMS. And then the last one is what they call Calgary IOC, and that's Integrated Operations Center. So what that is they have a number of people from within the zone, as well as EMS, and they work in a room day to day, and they work together on where ambulances are going to go, how they can free up beds, that sort of thing. So it's a better integration of making sure the services get where they need to be, and if one hospital is backlogged, they'll divert to another one and so on. So it's just a coordination piece between EMS and all the facilities in the city. So we're seeing that being developed in Calgary now. Next slide that I have speaks a little bit more to the advisory committee that was struck. So this is, there's a number of folks from different groups. As you can see, ambulance operators from different unions are represented, municipal representation on there. Indigenous communities, there's a real good mix of number of people on this advisory committee. They're going to create their first report from that group in May. So we'll see that come out of what their findings are in the first few months. But some of the work that they're doing, reviewing the EMS dispatch system, and this isn't to speak about the transition of EMS. That's not what's on the table. It's reviewing dispatch in its entirety throughout the province and making sure there's good process in place and work going on. It's not that transition back to our satellites. And again, to recommend improvement opportunities. And that's the advisory committee that's been struck. So we can expect their first report in May. So we're all looking forward to their findings on that. And with that, that's all that I have for a presentation today. Thank you.
Are there any questions from council for Mr. Holsworth? Councilor Penner.
Not necessarily a question, but I like what I've heard when it comes to the non-emergent transfers. To a lot of people that discuss ambulance, that's a big issue. Like, why can they not just be a handy bus, or it could still be an EMS vehicle of some kind, not a big, but just a van that takes multiple people to Red Deer, to wherever, to their appointments. It seems like the ambulance is taken, not, it's in service, but it's not available for those emergencies because they're doing transfers. So I like what I've heard there. Numerous times you had mentioned that there's pilot programs or they're looking into it. I think that's very positive.
Great, thank you. I can expand on that a little bit if you'd like. So non-ambulance transport, I'm not sure if you heard of that, or NAT it's sometimes called. We do have a NAT service in Central Zone. It's stationed out of Sylvan Lake, but it does work throughout the zone. So I've seen it here before. I've seen it in Drumheller. The problem with that is oftentimes it's single driver vehicles. And now we're coming into how it falls into the ground ambulance regulation, because it doesn't as a single person vehicle. So we're contemplating, it's the wheelchair vans, it's the single person type vehicle, and whether that fits or not, or do we move to a stretcher van capability with 2 people and call that a form of non-emergency or non-ambulance transport. So lots of work going on in that, but we're trying to see where we fit in the ground ambulance regulation in a larger scale. Thank you.
I guess further to that, Mr. Halsworth, you are well aware that Kneehill County did establish a Medi-Shuttle years ago, back in the early 2000s.
I am, sir.
And it worked very well.
It did.
It's too bad regulations have not allowed that to continue.
I don't disagree, sir. It was before its time, I think, for lack of a better term. I think it did a lot of work with the Medi-Shuttle here in Three Hills. I'm familiar with it.
Yep.
Yeah, it just wasn't part of the plan at the time, I guess. I know there's a lot of work going on with EMS transition and that sort of thing. So it is coming back around somewhat, so.
Well, I do believe it was dismantled and became a pilot project in other areas of the province and then just kind of washed away.
Yeah, the Edmonton and Calgary have always sort of had an IFT, or interfacility transport division, where sometimes it was the one person vehicle, sometimes it was the 2, but it really fell into there with the Edmonton and Calgary, not so much in the rurals for some reason. It's starting to catch on, and it really depends on, they go for the DI appointments, is probably their biggest piece. So if we're not going to get it throughout the zone, it's very difficult for somebody to start their day in Sylvan Lake at 7 o'clock, be here for 9, and try and be back in Red Deer or to Calgary by a certain time for a DI appointment. It's really time dependent on how they can get that work done.
Yeah, I can see the challenges. Are there any other questions for Mr. Halsworth? Yes, Councillor Penner.
Just another question. Under the 10-point plan, you talked about the Calgary Command Center. Would that command center be for the whole, even rural, or is it just a command center for Calgary?
It's for the Calgary proper, but it's going to impact our resources as well in the center, or in the zone. I shouldn't say ours, the rural resources, because if they can, oftentimes when our ambulance is going in, they are going for an appointment or a direct admit, so they don't always have an option of which hospital to go to. They're told where to go. This center in Calgary will be able to see that the foothills is overloaded. Let's start diverting those emergency patients to the Peter Lougheed or what have you, to decrease the number of ambulances sitting at a hospital. So that in turn will free up those ambulances quicker. One more piece of that, if I could. We have what we call in Central Zone our real-time operations coordinator. So it sort of works along the lines of that, and it's a supervisor that doesn't go on the street. It's a supervisor that's at a computer and sees all of the ambulances moving around the zone, and they will work to make the most efficiencies of what's happening for an event. You know, that maybe an ambulance, maybe they're more in tune of what's happening locally. So maybe an ambulance staff is just having a lunch and they have been for 20 minutes, so they're probably nearly done. Let's try and get them going to this call because they're closest rather than over here. So they're really that big brother or eye in the sky, I guess you'd call it, to do that work from a desk and try and coordinate the resources in Central Zone as best they can. So that sort of is similar, but more of a rural flavor, I guess. Works well so far for us.
Councillor Christie.
I see the one ambulance in Three Hills is 12 hours shift. Is that a demand situation or a staffing situation that can't be 24 hours?
It's always been a peak ambulance or a demand ambulance that we've always called it since the day of transition. It's always been that 12-hour a day, 7-day a week, and I believe it's 7 a.m. to 7 p.m. It was recognized then that it was more of a demand need. It just hasn't changed. So no, it's the same as it's always been. And I can say that it's fortunate that it is actually 7 days a week here in Three Hills. Most of them are Monday to Friday. So again, we took what it was and we've maintained that because it worked well.
Deputy Reeve King.
I'm quite happy to hear the initiatives that are being put forward. The unfortunate thing is you have to deal with that perception is reality for a lot of people. And the perception is that we are not well covered for ambulance service. And whether that's true or not, that's how it's viewed, right? And so when you talk about some of the initiatives where thinking about is the closest ambulance the most appropriate, is it right to divert that ambulance that's on its way back to its home base or not, and those kind of initiatives, as we see more and more ambulances back present in the communities that they cover and service more frequently, that'll change the attitude that we're just not getting ambulance coverage, right? And the ambulances are always in the city, and you hear that all the time. And I know that's not the full truth of what's happening, but sometimes you get caught in that situation. So I'm really enthused and happy to hear of the initiatives that are being taken. So I look forward to better things coming in the future. So thank you.
No, thank you. And just on that, thank you for that, sir. I gave the example before of the ambulance being pulled into the mall at Balzac, for example. That doesn't mean that ambulance from the rural will turn around and go back into a city hospital. They'll start the initial care on that patient, but they'll get what they call a transport ambulance to come in, take over care from Calgary or wherever that the event is, and they'll go back to the hospital and allow our crews to continue on to home. So they get stuck sometimes, but it's just to start that care, that crucial care that's immediate, and then they hand over care to the crews in the city.
Councillor Cunningham.
First of all, I just want to thank you for the service that you folks provide. I can't imagine these last couple of years have been easy on you. I did have a ride with you folks a couple of years ago, and I have to say the service was amazing, and so just want to thank you for that. I am hearing a lot from, further up to what Deputy Reeve King is saying. There's a Facebook page, I believe, which we can't believe everything on Facebook, I know, but it kind of shows where the ambulances are currently. I don't know if that's accurate or not, if you could help us out with that, but I do get a lot of calls, emails from residents saying, they noticed, one night the 6 rural ambulances were all in Calgary, which leaves us with nothing here, which is pretty scary for rural residents. So I'm just wondering if you could provide us any information on that.
If it's the same one I'm thinking of, sponsored by the union HSAA, a lot of times, they may put on there that there's no ambulances in a community, or there's an event in Calgary that Linden is responding to. Doesn't always mean that they're responding from their home. If they're in the city, but they belong in Linden and they get sent to an event, it may be skewed a little bit to say Linden Ambulance has responded to an event in Calgary. So I don't pay much attention to it. I know that it's out there, but I can't really speak much to it. My apologies, but that's what I would probably say is don't read everything that you hear. You're welcome to phone me anytime you would like if I can assist with any of those questions that you have after today.
Councillor Penner.
And I'm not sure how you can answer this or not, but I've traveled quite a bit of the province, and in the last 2 months, I've been in southern Alberta and north of Edmonton, and in both places, I've seen ambulances that, and especially the one recent was at St. Albert Fire. I think it said St. Albert Fire Services. It was an ambulance, and I guess there are still communities out there that have agreements with AHSs there, and can you see more of that happening or not? Are they trying to get away from that altogether?
Thank you for the question there. We in the Central Zone actually have the most contracted services in the province. We have 12 currently. So St. Albert isn't obviously in the Edmonton zone. For us, we have Red Deer, who's a fire integrated service, so run by the city of Red Deer, but they're a contract service to us. Stettler is, Three Hills was, or Kneehill was at one point. Guardian out of Pinoka, Innisfail, Wetaskiwin is one. So there are pockets of them all throughout. When we started this in '09, AHS and EMS becoming provincial rather than municipal, I guess, responsibility. There were some that we transitioned right away. Where I am in Flagstaff County, Camrose was one of them as well. But we've never approached any to say, you know what, we're gonna not contract you anymore, we're going to take you over. As these decisions come up from council such as yourself, that's when we sit back and we come and engage and have that discussion about what is best. So yes, there's a number of contractors out there. There's no intent ever that I know of to not have contractors. I think they do a good service. Regardless of who it is, they use the same protocols as Alberta Health Services. We have the same medical director. They use the same dispatch. And they just have a different shoulder crest on their uniform as well. But everything is identical.
Oh, Councilor Penner?
Just to follow up to that, so they are funded and everything the same way? Like, I think it's in the Canada Health Act that patients aren't charged, or they're charged a minimal fee or something. I'm not right up to speed on it, sorry, but so their funding is the same? They are 100% funded by or are they municipally funded to a certain percentage?
Right, so EMS isn't a funded portion of health. So if we have an incident today, there would likely be a bill generated. But it doesn't cover all of the cost to run an ambulance service. It's a fixed rate put out by Alberta Health that we play or work with that within the budget. So we know what they expect for revenue, and we work off of that to see how we, from AHS, can top it up for them to maintain service. When we talk about St. Albert or Red Deer, they're not-for-profit, so they need to keep work going, but not make a profit. We have some that are society, but we also have some that are for-profit in the province, and they have that built into their agreement, but they're oftentimes so big that they have those economies of scale, so it's not as noticeable as you would think when they have a built-in profit or a profit margin. It's still a reasonable amount, otherwise they wouldn't be on a contract. So, thank you.
Deputy Reeve King.
So you did use the word dispatch, and of course that's been a concern for large parts of the province as we've gone to more centralized dispatch. And of course we hear the stories about people who call in with emergencies and have real trouble getting understanding of where they are and those kind of things. So could you just give us a bit of an update on where things are at with dispatch and how the concerns that are being raised are being addressed, or whether they are even being addressed? So.
Thank you. As I put in here, I believe that any concerns are being brought forward to the advisory council or committee. So they will look at those sorts of pieces or trends that they may see. When it comes to dispatch, and I'm not a dispatcher, and maybe John can add to it, but any dispatcher can pinpoint where you're calling from at today. So I don't think it's always a necessary piece of dispatchers not knowing where they are. But prior to the transition, so we had 3 satellite dispatch centers, Fort McMurray, Red Deer, and Lethbridge. Again, similar to the ground ambulance, they had all the same protocols and all the same procedures as AHS. They were using the exact same equipment as they were in Calgary or Edmonton for AHS. Again, the only difference was what uniform they are wearing. So that is sort of one of the pieces that really they were following the same things. Additionally, if Red Deer, when they were a satellite, were busy, those calls would automatically be shunted to maybe Grand Prairie, to that center up there, and nobody would know that, right? So it was sort of a seamless piece. So when I hear potential issues of where people maybe dispatches not knowing where somebody was phoning from, I think that could happen regardless. I don't know if it's necessary because the dispatch isn't as local as it was. That's my opinion.
Thank you for that. I just, you know, you hear the stories, and of course, that's always a concern for people as much as the issue of can I get an ambulance or not? And so just thought I'd like to hear your comments on it, so I appreciate that. Thank you.
Welcome, thank you.
Mr. King, if I may add to Scott's comment. So in the dispatch center, we have a system status management division, and in that division is the GIS team, Global Information Systems. So our GIS members will take maps from the local counties or municipal government and then make sure that that map is accurately portrayed into our computer-aided dispatch. So at any point of time, our paramedics, when they're on a response, can open up their computer and pinpoint the map with the most up-to-date information that we have available. So did I detect sort of a hint of how do we dispatch province-wide if we're not familiar with the local area? So we really rely heavily on those maps. And then I will work directly with your fire chiefs of the local area to make sure that those maps actually represent the areas that they're responding into, as well as our ambulance crews.
Thank you, John.
It's just an issue that's a concern for people, right? And you hit it right on the nose when you say, how can somebody who's sitting in Edmonton know where I live, you know, in Louisiana or east of Huxley or whatever? And so it's a concern, and so anything that can be done to help alleviate those concerns, I think are advantageous to the dispatch and the ambulance service overall.
And we do rely heavily both on our EMS crew and the local fire departments to have that local familiar knowledge. And so our dispatchers can talk in real time to the responding crews, whether it's fire or EMS, and give that most up-to-date information. I wish I'd had that information as I left Calgary on the Deerfoot parking lot.
Yeah, GPS isn't everything, is it?
Yes, Councillor Cunningham.
I just had a question that was brought to me from a ratepayer. They were just curious how many emergency direct transfer vehicles would we need in Kneehill to service current or future volumes?
So that's part of the hours of work piece that they're looking at, the fatigue management, or whatever you'd like to term it as. They've really put a lot of work into coming up with a formula, and far smarter people than I have dealt this. But they then can do some modeling based on the events that have happened over the last number of years in Kneehill. And they can then determine, one, are the ambulances in the right places? And two, is there in fact enough ambulances? Should that peak ambulance in Three Hills change its hours to better fit what the needs are? So there's a lot of that work going on right now. We're going through what we call phase one, and as I mentioned, a lot of work around Red Deer right now. Phase two is coming, and we may see some more changes such as that out in Three Hills into the Drumheller, or that sort of area where there may be a need. So there's a modeling going on in the background, if that helps.
Yeah, Councillor Cunningham.
Sorry. I know this is a very specific question, but it's kind of been brought forward from a few people and some of those in AHS that one of the concerns is, well, not a concern, but problem is that those ambulance folks have to stay at the hospital with the patient until there maybe the care is transferred over. So there's kind of, those people are kind of being held there where they could be, you know, on the road going to other places. Is that a concern? And I guess in terms of what we could do, like how can we, you know, maybe advocate for our ratepayers to have adequate service here?
Thank you for that. It is a concern. When we see that, we can't simply hand over care to nobody. There has to be a report given. There has to be a bed to transfer the patient to. Red Deer specific, we're seeing a couple things. One is what we call transition to waiting room. So a lot of patients, right or wrong, think if they come in by an ambulance, you're going to be seen quicker by a physician. And that's not always the case. It's never the case. It shouldn't be the case. They're put into a triage system just like everybody else, but if a patient on an ambulance fits within the parameters to simply sit in the waiting room, then that's what they'll do and frees up that crew a little bit quicker. But we also see in all of the hospitals, obviously in Three Hills, we wouldn't see it, but the larger places, it is patient consolidation. So if the ambulance from this community was in there, again, nothing really life-threatening as far as care needs, they're going to be admitted, they can hand over that care to another ambulance that's also sitting in the hallway to free up and that crew. So there's actually a policy that we have around that for patient consolidation for all of our facilities in the province. So it helps that way. Depends on the patient needs. If they're on a number of different pieces as far as ECG or IV fluids or anything like that, there's certain guidelines that they won't be able to consolidate patients. Yeah.
Councillor Forbes.
Just a question about when they decide to go to the hospital and the the patient can be put into the waiting room. The patient still would be on the hook for the bill to get them there, would they not?
If it's an emergency event, it is what we call a billable event. So sometimes people have insurance, sometimes it's a car accident where vehicle insurance kicks in. But yes, there's a bill generated likely for that.
Okay.
Are there any other questions for Mr. Holsworth? Well, doesn't look like it, Scott. Thanks for doing your presentation. I know I've been around for a while. I was here during the transition period. One of the considerations we had back then is that we wouldn't see a degradation in the service levels. Well, things have changed. And I know last 2 years, going on 3, hopefully not 4, there has been quite a change in the health of the province. So hopefully you guys can get everything back in row and continue the emergency services that are required by our residents.
I agree, Reeve. Thank you for that. I will stick around for John's presentation, and if there's any other questions after that, I'm happy to answer. And if I can come back in a few months, once these changes are put into place, happy to do so, sir.
Well, that would be great. So, Mr. Hine, you have a presentation.
Not so much a presentation, but here to answer any questions. I was asked by Chief Dan Marsalis if I could just give a quick overview of what Medical First Response is about. It is a program where we provide support to agencies that go on to medical calls. So by defining that, a medical first response agency is any agency that are trained and equipped with medical equipment and are able to provide medical care and are routinely dispatched by the 911 dispatch system. So in Alberta, the vast majority of MFR groups are fire-based. We have a few locations where it's off-duty EMS practitioners, or they could be safety personnel on an oil platform. But here in Alberta, probably 98% are fire organized. We work directly with the fire chief and his officers to create a response plan for their community. MFR is voluntary. So if you as the municipal governance and the fire chief do not want to go on to medical calls, you're not obligated to do that. If you do go on a medical call, we'd like to tie that into the computer-aided dispatch by creating a response plan with the fire chief. So you can determine what kind of calls you want to go to and also the level of care that you want to provide when you get there. In some communities, some fire chiefs want to know about everything that an ambulance is going to and be notified to that. In other communities, they only want to go to the high acuity, the Delta Echo, where there's a life-threatening emergency. So we can massage those response plans to meet the needs of that particular community. Also with our program, we offer training support, so we have online modules for the firefighters to become familiar with. We also have ties in with Red Cross in order to provide the first aid training, everything up to and including primary care paramedic. So again, that's something I would work with those fire agencies to determine what are their specific needs. We also have a soft exchange program where if a fire department use any particular equipment or supplies on a patient care, we try to provide the recovery of that supply on the spot by the incoming ambulance crew, or I can ship that material out to them at a later date. We also provide supports to the fire agency on the training for our opiate crisis. So we have access to the Narcan take-home kits, and those are provided free to the fire agencies, as many as they need for their response vehicles. And then this is all tied together through an online dispatch system, an online website that we have, albertamfr.ca. It ties in the agency and all its personnel to have the ability to do patient care documents and to do that online training, as I mentioned.
Any questions from council for Mr. Hein? Well, doesn't look like it.
It means it's working well for the fire departments, we hope.
Well, yes, it does work for the fire departments, so. Well, thank you very much, gentlemen, for coming before us and doing your presentations. We do appreciate it. Being kept in the loop is great, and we do appreciate your time. Councillor Christie.
I'd just like to say thank you. I appreciate the service. I hope I don't ever need you, but thank you.
Councillor Penner.
I want to thank you guys too, and I'm also looking forward to that report in May, especially for rural here, to see what's in there for us.
I agree, and again, once that's out and we have a chance to digest it, happy to come back out to meet with council and sort of look at it a little bit closer, and maybe then I'll have more stats and see what the impacts are.
All right, well, thank you for coming. Sorry that you got delayed on your... Yeah, yeah. All righty, does anybody need a break? Seeing as not. We're next, safe trip home, guys. Our next agenda item, 6.1, tax deferral request. Welcome, Ms. Severson. I know you've been waiting for this moment, and so have we. Anytime you're ready.
Thank you, Council. So I'm here for a decision on the Perisson Limited Tax Deferral Agreement request. Petroleum requested a tax deferral agreement back in December of 2020, and Council made a motion to allow them time to pay the 19 and 20 taxes over a 12-month period, with all 2020 penalties being voided and no penalties during the term of the agreement. After this council meeting, administration was unable to get a response from Perisson in regard to signing the agreement and starting payments. And I believe that was just due to the economic and cash flow. They just stopped communicating because they really couldn't afford to pay. So in early December 2021, they did finally respond to my request for a response, and they were able to start negotiations again, and they have made their first payment, so we are on track. So in recent years, in order to assist companies during this difficult economic time, Council has been proactive in utilizing the tools as allowed by the MGA. The MGA allows for Council to cancel, reduce, or defer taxes, as well as enter into tax agreements for payment over time to a maximum timeline of 3 years. The intent has been to minimize the delinquencies in payment of the taxes by providing time to pay without penalty. We've been very successful, as you know, with this course of action. Council has approved 5 similar requests for deferral over the last 2 years. I have one more forthcoming in a month's time. Perisson is requesting a new deferral agreement since the timelines approved by Council have lapsed. The total arrears owing at this time is $12,805, and the estimated 2022 levy is $4,020, for a balance of $16,825 to be repaid. Perisson is asking permission to pay $760 monthly from January 2022 to November 2023. The balance, which includes the 2019 to 21 tax arrears and the estimated 2022 levy. They have also requested that the 2020 and 2021 penalties be canceled and no penalties be assessed until December 2023. The penalties voided would total approximately $4,000. Perisson has already forwarded a signed agreement, so I have that on hand, and they have made their first payment on February 1st.
Okay, thank you.
Thank you.
Are there any questions from council to Ms. Severson? What are council's wishes? Councillor McGee.
I move that we agree to enter a tax deferral payment agreement with Petroleum Limited for the payment of 2019 to 2021 tax arrears and the 2020 levy for the period of January 31st to November 30th, 23.
Okay, thank you. We have a motion before us. As per our, I don't see it on screen, but we have a motion before us as in our council package. Is there any discussion to that motion? Councillor Cunningham.
Sorry, I had a big sigh there. So, yeah, I guess it just gets really hard to, to be waiving these taxes all the time. I know, we're happy to be getting something out of it, but I know I've heard from ratepayers that, it's quite a blessing to be able to have your taxes, just waived, if you're a oil and gas company or whatever it may be. So not really a question, I guess, just a comment that yeah, it is hard, but I guess, are we just happy to be getting what we're getting as opposed to nothing, or do we fight harder to get that other amount?
Well, the only thing we're canceling is the actual penalties. So the tax levy, which is what council budgets for each year, as included in the revenues, we are getting those. So it's a give and take, right? It's up to you, though. It has been our practice. We've been following the same practice and been consistent with each of the companies that we've dealt with. That's really important, I believe, and we have been doing that, so that's a good thing. And it's hard to say no to one when you said yes to another as well, so.
Deputy Reeve King.
I guess there's always been a bit of a torn situation, but very much appreciate the efforts that are being made to work proactively with these companies and to achieve what's being achieved. Kneehill County has made great strides forward in this area, and in large part that's due to the hard work being put in, not by council, but by our staff. And so I just want to acknowledge that and say it's appreciated. And I recognize that giving up on these penalties is sometimes not that palatable, but it's the real world in which we live. So, so thank you for the efforts that are being made.
You're welcome.
Is there, yes, Councillor Forbes.
Just a quick one. How is it determined that it's $760 monthly that they have to pay?
Just divided by the number of months of the time period. So on this one, because they're paying January of 2022 to November of 2023, we just divide the balance by the number of months.
Councillor Cunningham.
Thanks. I just want to clarify too, I am very appreciative of the work that your department has done, because I'm very aware that we are getting a lot more than other municipalities are. So yeah, certainly appreciate the work that you folks do. And it's just unfortunate, but that's no fault of yours for sure. So thanks.
Yeah, no problem.
Mr. Hogan.
Just to add into that, so the council's aware, administration doesn't find this as a completely palatable approach either, but we do recognize it is one that's put us in, I think, a better position than many municipalities out there. Of course, the trade-off is those arrears that we're waiving. None of this precludes council's ability to continue lobbying on other fronts, such as through the rural municipalities of Alberta and other entities, to give municipalities more power or more of a hammer to actually collect these. Bill 77 was touted as a pretty big win. I don't know that it was a pretty big win, but at least it was a step. There are other things that you as council can continue to lobby on behalf of additional enforcement, not enforcement, that's the wrong word, additional powers through the Alberta Energy Regulator, as an example. Continue on that so far the provincial government has been loath to pursue. But even taking the route that you have here and taking this process where of waiving the arrears to enter into a payment, which all the companies we've been involved with have honored so far. That doesn't stop you from still lobbying on the other side for additional municipal tools to actually enforce that, so that we and other municipalities don't have to take this route.
I do find that with these companies that continue to be active and don't really want to get into a situation where we have to get legal involved, that's usually enough of a scare point to get them to talk to me too. So these are, companies that I think are really doing their best with what they have right now and trying to move forward and trying to keep their companies afloat. Unlike Trident, of course, who went into receivership. And I mean, that's our biggest customer that we have no chance of probably recovering much of what they owe. And so I am always happy to work with these companies and do my best, but I always really enforce the consistency between what we're doing with them at the time I'm talking to them and what we've done with other companies. So I don't bring it to council until I know that they are in agreement with that, because it's really important that we keep that consistency and not go backwards from that.
Yes, thank you very much, Ms. Severson. It's a lot of hard work to get this money back. It's unfortunate we have to give up the penalties, the arrears and these things, but at least we're getting these companies up to date. And that's the important part.
Yeah. And it's looking good for the future at this point, so that's good to know too.
Okay. Is there any other discussion to the motion? Councillor Christie.
Just a comment that I appreciate very much the work the administration is doing, and I hope the provincial government's paying attention and give us some teeth to get to do the penalties and stuff, but right now we can't. So this is the best case scenario, so let's proceed.
And the other point too is the courts, when they're agreeing to these purchase and sale agreements through the court orders during the receivership process, they are often not saying, they say the new company doesn't have to pay any of the penalties, that they just pay the prorated amount for that current year, and that's all they have to pay when they take over the license. So the courts aren't helping either in that regard.
Okay, is there any other discussion to this motion? Okay, motion reads that council agrees to enter into tax deferral payment agreement with the company and to forgive the arrears and to be caught up to date by November 30th of 2023. That's kind of my summary of it. The actual motion is in front of us. If there is no more discussion, I will call the question.
Just a minute.
All righty, Deputy Reeve King.
Okay, no, I got it clear, sorry. I'm good.
Okay. Councillor Christie, you were, no, you're. Oh, okay. I will call the question then. All those in favor? And that's carried unanimously. I do believe there's a second motion to be made. Councillor Christie.
I'll make the motion, the administration cancel the 2020 and 2021 penalties, and no further penalties will be assessed during the term of the agreement.
All righty. Is there any discussion to that motion? Councillor McGee.
Acknowledging that this is the best tool we have to be successful and certainly isn't palatable for our residents. We recognize that, but as has been pointed out in many different ways, this is our only tool and for success in our region, and so our county. And so I just wanted to reaffirm that this is not we don't like it, but it's our best tool.
And I support you fully on that one. Is there any other discussion? Seeing not, I'll call the question. All those in favor? And that is carried unanimously. Thank you, Ms. Severson. Our next agenda item, 6.2, tax auction sale date. Welcome back.
Thank you.
Anytime you're ready.
So unlike oil and gas taxes, land taxes, I have this tool available to me. So I'm here today to ask for council to set the public auction sale date for Thursday, May 26th at 2 p.m. Pursuant to the Municipal Government Act, Section 418, council must set a date for public auction for all properties with more than 2 years of tax arrears. These properties have had a tax notification registered on their property since March 31st, 2021, and numerous correspondence from the county as to the amounts due. The tax sale date is required to be set with time allowed to ensure that advertising requirements can be met. During the time between now and the sale date, administration works diligently to collect payment or have the owners enter into a tax agreement for payment over time. Currently, there are 16 parcels, which is just 3 owners, that will be affected by this legislative process. For financial and staffing implications, of course, there's no staffing implications, but the parcels are charged a $100 fee when the tax notification is filed in the previous year. So when we registered the tax caveat, they were charged $100. That generally covers the cost to do the registration and such. So I'm just requesting that council approve the dates for May 26, 2022 at 2 p.m. And hopefully we won't need it.
Okay, thank you. Any questions? Any motions? Deputy Reeve King.
So I'll make the motion then that we set the 2022 tax sale public auction to be held on Thursday, May 26th, 2022 at 2 p.m. at the County Administration Office.
Okay, thank you very much. We have a motion before us to set the tax sale date for May the 26th of 22 at 2 p.m. A lot of twos in there. Is there any discussion to that motion? Councillor Forbes.
It's more of a question. When was the last time you actually put up public lands for sale?
Last year.
Oh,
Yeah, and that property, we didn't get anybody at the auction itself, but it has been put out to tender in the paper, which closes on February 28th. So.
Are there any other questions? Yes, Councillor Forbes.
sorry, just because we just did for the oil companies, I know that if anyone's watching this, they're gonna wonder, do you take the same steps that you would for an oil company as someone who owns the lands as well, like to work out?
We will agree to a tax agreement, payment plan, and
Okay.
I do my best to get them on that as soon as possible, but penalties still do accumulate at this point. We don't have anything in place to not do that.
Okay.
It's something that I would like to see us work on, but
Yeah,
it hasn't come forward yet, so.
because anyone just watching that would be like, well, why can't I have that, right? Do you know what I mean? I get it, but it's just, I could see the frustration with people watching.
Yeah.
Mr. Hogan.
Yeah, through Mr. Reeve, to just follow up on what Ms. Severson has said, is we do, again, this is not our preferred approach when we get to these. So our tax department does put, our tax department are right there, does put in a lot of work trying to approach those individuals to have them, you know, it's better for us if we're able to work with that individual and have them pay their taxes, as opposed to getting to the point where we're selling a property. That's not preferred for anybody. It's not the preferred outcome. So we do work with them. As has been pointed out, the difference is that when we do work with those individuals, the arrears form part of that tax payment agreement. And that all relates back to the tool set that we as municipalities have, is we have the ability with, you know, whether it's the farm or the acreage or that type of parcel or commercial entity, that we can put it up for auction, we can sell it, we essentially take ownership of the property, and we can do that. The problem with oil and gas is we don't necessarily have those same tools, and even if we did, we don't necessarily want them, because you're taking a facility that you might be, the last thing you want to do is take over a well that needs a couple $1 million worth of cleanup on it. So you don't want that liability, that operational and environmental liability related to those facilities. With the residential one, we just have greater tools. And that's part of the lobby effort that council has been on for years now. As part of that broader provincial, rural provincial municipalities lobbying the provincial government to give us additional tools so that we can approach industry bad actors in the same way that we can approach these. So that's that lobby effort I mentioned previously, is trying to bring them more into alignment where we do have better tools, and we don't need to be waiving that. But this is simply a case we have better tools in this instance.
And just on another note, often the ones that I bring at this point that I still have outstanding are consistent. Every time. Yeah. So,
Okay, so we have a motion to set the tax sale date. If there's no more discussion, I'll call the question. All those in favor? Carried unanimously.
thank you.
Okay, thank you, and I will call a break. 7.1, letter of support. Mr. Hogan.
Hey, through you, Mr. Reeve, to the members of council. As council is aware, I previously made the decision to support the town of Trochu's initiative to provide senior housing. That, of course, being through the mechanism of the Trochu Housing Corporation. That the county's support of that was to act as a guarantor or a backing for a potential loan that that organization would take, given that that loan would have been outside the ability of the town of Trochu to take on their own. That's related to the Municipal Government Act restrictions on how much debt a municipality can take on relative to their budget and such. So the county made that decision, and they're to act as that backing should it be needed, with the intent that it possibly won't be. But we are looking at, I shouldn't say we, but the Trochu Housing Corporation is looking at applying for grants, which is part of the conditions that the county put on their support. So one of the conditions is that the Trochu Housing Corporation, the town of Trochu, need to raise a large component of grant funding for the project, and that if they're not able to raise that grant funding, that the project doesn't go forward. So in anticipation that those grants are going to be opening up and that applications are going to be coming available, the Trochu Housing Corporation and the town are asking for letters of support from strategic partners to demonstrate a broad appeal for the facility. So the recommendation that's attached is that administration provide a letter, or sorry, that Kneehill County direct administration to provide a letter of support for the Trochu, for the Seniors Complex project. That would be used by the Trochu Housing Corporation and Town of Trochu to be included in their grant applications. And there is a form letter that is attached to the item. That being said, that is not necessarily the specific one that we have to send. We've worded the motion in such a way that we can take a look at this. We can make any alterations that we would like, and send a letter accordingly.
Okay, thank you, Mr. Hogan. Are there any questions from council for Mr. Hogan? If not, what's council's wishes? Deputy Reeve King.
So I will make the motion that council provide the town of Trochu a letter of support as requested for the capital grant applications that they require for the Trochu Senior Supportive Living Facility Project.
Okay, thank you very much. We have a motion before us to send a letter of support for the Trochu Senior Supportive Living Facility Project. Is there any discussion to that motion? Seeing as not, call the question. All those in favor? And that is carried unanimously. All right, next agenda item, 7.2, strat planning presentations. Mr. Hogan.
Okay, through you, Mr. Reeve, to council. As we started at a previous meeting, was in preparation for council's undertaking of crafting a new strategic plan for your term of council, is we have been making presentations in order to provide council with some background, with information, with relevant discussion. Again, as part of today, you may have questions posed to you. Those are not intended to necessarily be answered today, but to look for guidance or future discussion as council goes into the facilitated strategic planning session. I think council's got a good beat on that from previous meetings, so I think at this point I'll turn it over to our transportation department, and they are here to wow and delight you for the next period of time.
Welcome, Mr. McKiernan.
Good morning.
We're ready to be wowed.
Yeah, if you could, that'd be great. Yeah. All right, so good morning, council. So I guess This will be our environmental services small presentation for your discussion. So we'll start with the current environment within the water section of environmental services. So basically with the current staffing levels that we have now, we're able to maintain our current service levels for water and meet all our current regulated requirements as well. Some of the latest studies that have been completed is the Hamlet Infrastructure Assessment, Three Hills East feasibility. That one is almost complete. I'm hoping for the final draft here in the next week or so. So just to kind of what our current systems are, the majority of our systems are rural water systems, and these have all been engineered to provide residential service with a potential, and that's kind of the biggest word there, is potential maximum of 4 imperial gallons per minute at 40 PSI. So our most recent major project was the upgrade on our Trochu water system, and that was completed in 2020. We also operate 5 bulk water stations that offer accessibility to potable water 24 hours a day, all year round. So our current environment, again, in our wastewater area, is again with the current staffing levels, we're able to maintain the current service levels of wastewater and meet all our current regulated requirements. Again, some of our most recent studies for this would be the Hamlet infrastructure assessments that we did. Was it 2018? A few years ago, we did do a couple sludge assessments on our Swalwell lagoon, or no, sorry, not our Swalwell, sorry, our Wimborne lagoon and our Huxley pond. We did sludge assessments on there. The most recent major project in this division was our Swalwell lagoon upgrade, rehabilitation, and that was completed back in 2012. So we do operate 3 gravity-fed wastewater systems with lagoons, and we operate 1 low-pressure system with an evaporation pond or a holding pond. Our current environment within the solid waste section. So again, just our current staffing levels, we're able to maintain our current service levels for solid waste and meet our current regulated requirements. And the current regulated requirements are more along the Class 3 landfill that we operate out at the Torrington site. We do offer our residents access to 6 transfer sites throughout the county and 1 Class 3 landfill. 4 of those transfer sites are operated and maintained by ourselves, and 2 are by other municipalities. Our latest, most current study was the landfill airspace that we completed. Probably, I think it's been about 4 years now. One of the other things that we're doing to maintain our landfill is that we're using all our options that are available to us to divert as much waste from the landfill into the different areas that we can either recycle or reuse, that sort of thing. So some future opportunities and challenges within our department there for the water section. So again, some of the opportunities is the Three Hills East water delivery. That, like I said, I'm hoping for the final draft here in the next week or so, and then we'll be bringing that back. I guess one of the things there is the high estimated direct connection costs, and we currently don't have any funds currently allocated towards this type of a project. Some other opportunities would be the connection to the hamlets of Huxley and Wimborne to our rural water systems to get away from the groundwater. This one, we don't have any funding currently available, but usually these connections to a hamlet sort of thing are eligible for Water for Life funding. So another opportunity or a challenge in the future could be providing water needs for future commercial and industrial opportunities. Some of our systems, depending on where these things are, they may need substantial upgrades to supply these users and that kind of volume and of water that they may need. Again, our water systems were, like I said in the first slide, were engineered at a lower rate than a lot of these places may require to operate. Some future opportunities and challenges within wastewater. There is always an opportunity to improve upon our low pressure system within the hamlet of Huxley, upgrade the Wimborne Lagoon, upgrade the Torrington Lagoon, and coordinate with potential road repairs within hamlets to address sewer main lines that are of concern. And another one is utility rate cost recovery review as well. Some future opportunities, challenges within the solid waste. So we do some of this, but we can also develop a recycling program that would include development of maybe a recycling depot or a recycling center. Expand on the current recycling offered, where it's offered, so look at our sites and see what can be improved upon in those sites. And establish partnership with neighboring municipalities for future landfill needs or proceed with constructing operating of a county landfill, as ours is running its course shortly. So some overall future considerations from our department. So things that we have to think about are the tighter restrictions through Alberta Environment and Parks. And we are starting to see that within like the fluoride that we're seeing now and that sort of stuff. So they're reviewing all their code of practices. So I believe there may be some other ones that we may be seeing that might also have some impact on us. We have no control over our source water. All our water, other than our 2 groundwater in our hamlets, are all controlled by another entity, another municipality. The capacity limits on our water systems, limiting future connections. Currently, we have all our systems that, we have risers out there that aren't getting used, but they are already spoken for and identified for a certain person. So our future capacity limits may be lower. We did build some in, but that's been a while, so we are looking at that kind of thing. Inability for current infrastructure to meet possible future commercial and industrial demands. I kind of spoke about this a little bit before. The way our systems are engineered, some commercial and industrial, they may demand a lot more than what we're able to give them without any substantial looking at our infrastructure. The funding for our larger projects that we have coming up or could be on the horizon. And another consideration in our department is retirements of personnel. So we are a small little department, but in the next few years, we may be seeing, I want to say almost half, because there's 5 of us, so about 2 that may be retiring. So there's that we have to look at as well internally as our organization. So is there any questions or comments within that water, wastewater, solid waste that I can help you guys with?
Deputy Reeve King.
You did
Hair's
mention the
close.
low-pressure system in Huxley, and I know we had quite a problem with it a couple of years ago in a large rain event. And I've had lots of questions, comments about possible improvements in that system. We haven't, and I sort of almost know the answer to this question, but we haven't done anything to look at improvement or change in that system, have we?
Through the Reeve, no, Councillor King, not formally. I mean, I guess just within our department, we've always talked about things like that. But I guess, I mean, we had that one incident a couple of years ago. There was probably a big reason behind why that happened. We did try to address that through communications. Maybe it's gotten better, I'm not 100% sure. There are options that we can do, right? But it's all about bringing forth a project. Nothing's been done through a consultant or anything to get that engineer stamp. Just thoughts through operators, that's about it.
Yeah, just as a follow-up, I know I had a lot of questions about that low-pressure system well campaigning, and there seems to be a fair amount of interest from the residents there of some kind of solution. So that would seem to indicate to me that there are some ongoing problems that they're living with and not really making too much of a uproar about. So just wanted to get that out there.
Sure. And that's great, but yeah, I haven't fielded very many calls at all from anybody of what their concerns may be. From an operational standpoint, it's working how it should be working. But if there's individuals that have an issue, I myself have never heard it other than that one big event. We got the phone calls after that. I haven't heard anything from them, so.
Any other questions from council for Mr. McKiernan? Well, looks like you're off the hook, John.
Thank you.
Well, welcome, Mike and Mike. You
I didn't
guys
even
are all
realize
lined
it.
up now, all three of you.
Everything in your peripheral here is Mike's. Yeah.
All right, anytime you're ready.
So yeah, good morning, council. Thanks for taking the opportunity to listen to us. So basically, as CAO Hogan has mentioned, what we're doing here is kind of giving you a high-level overview of some of the prospective projects we can look at for the future here as we get into the strategic planning discussions. Some of the things with infrastructure, like John mentioned, with Three Hills East potential and at the same time some of the costs that come with that. This is where council is going to look at where you want to best spend your money, best spend your tax dollars, and look at projects going forward that make the most sense for council at this time. So with John mentioning the environmental side, Mike will speak a bit to the current service levels we have right now with maintenance, and then I'll speak a little bit to capital projects going forward.
Yeah, so on road maintenance for our current summer level of services, our gravel roads are graded a minimum of 6 times per season. Dirt roads are graded a minimum of twice per season. Road repairs are determined by the road program supervisor and then passed along to the project supervisor. Private driveways are done after grading agreement is completed with the office, and then the supervisor will determine a schedule of going back and blading that driveway when it's graders in the area. Future opportunities for summer maintenance is review the policy on grader rotations and dirt trail maintenance. Option to base rotation more on needs than predetermined value. Certain roads need bladed more than others. Review policy or private driveway policy, pros and cons to providing that service, and then review grader division mile distribution to ensure the most efficient method is utilized. Future challenges, implementing a supervisor discretion rotation, educating ratepayers on why certain roads are bladed more often than others, and then potential of adding more assets and staff if a higher level of service is determined to be needed or desired. And then for winter current level of services, local roads, gravel roads will be opened within 24 to 120 hours of a snow event. Our paved roads and chip sealed roads will be 24 hours of a snow event, and then hamlets are opened within 24 to 120 hours. And then private driveways after completing the grading / snow plowing agreement with the office, and then scheduling a grader to get back to those ratepayers eventually. Future opportunities, review priorities for winter maintenance and timelines, and review private driveway policy. And then for the challenges, it'd be increasing level of service timeline would mean more assets are needed to meet those deadlines if we're to narrow them up. And then for our gravel program, our road program support supervisor assesses the gravel roadways along with the grader guys. They know what roads need gravel and what ones don't. Then minimum of 640 kilometers of gravel or roads are re-graveled per year. Depending on the condition of the road, it should be re-graveled every 2 to 7 years. And then when re-graveling our roads, it's between 230 and 400 tons of gravel depending on width of the road. Future opportunities, review our gravel hauling cost and see if there's room for improvements, review gravel specification policy, and investigate for a gravel source in the south end of the county. For future challenges, the perceived lack of gravel sources in the county may cause challenges. Environmental permits can take years to get things going, and fewer stockpiles result in longer hauls. And then for bridge maintenance, historically, we spend $2 million annually to invest in repair current bridges for longevity. Yearly inspections are completed by outside contractors, which provides a list of maintenance to be done to each bridge that they inspect that year. And then bridge decks are cleaned on a scheduled basis or as needed. Future opportunities: develop a 5-year bridge repair and replacement program, potential to invest more funds into repairs and effective maintenance and to improve longevity of bridges and defer replacements. The challenge is large budgetary commitment to enable program. There are many bridges that are coming to the end of their usable life cycle and will need repairs or replacements.
Great, thanks, Mike. So I'll get into the current status we have with our road construction program and plans such as that. So the county approved a road construction study back in 2014 that really gave an ultimate 28-year construction program for some of the roads. It was a pretty intensive study, lots of traffic counts, lots of talk about sight lines, and it was good. It was good background information to have, and we still have that information to date to utilize. Unfortunately, that plan really wasn't utilized to its capacity. It wasn't followed really consistently, mainly because design or projects changed and densities and based on planning decisions, different roads were brought up to the front based on approvals and need on that time. So really that study was good for background information, but not really good at projecting where we should be putting our future road construction. Case in point, the road we were intending to build in 2021 was nowhere in the plan to begin with, and that was based on an approval for a grain terminal that happened after that plan was done. So these plans are good to have, but 28 years is definitely a little bit excessive for planning procedures. I think a 3 to 5 year is more where we need to point to still have enough time to look at current stresses, look at current needs, planning proposals, as well as having time to have really, the intent if we go forward with the road construction program is to have a few shelf-ready projects that we have all the approvals from environmental done, ready to go in, all the landowner approvals done, and basically go in with a contract tender for construction of that. So that's something, if council agrees, we'll hopefully go forward with as part of the planning of this year. So some future opportunities, like I said, the 5-year, I would say at a max construction program developed and really base these plans on some set parameters, some set metrics that we can look at for safety, development zones, trip counts, current densities on the road, as well as future development where we want to direct some of the new development in the county. We want to make sure that the roads surrounding them are up to standards, so we don't have to, for instance, put a new high-intensity development on a banned road. We want to avoid those kind of things wherever we can. So having this program in place, working with planning and working with ratepayers to have an agreed-to plan, I think is the direction that we're hoping to go this year and the next couple of years. So with the road construction, I want to look at paving and just kind of see where we want to direct, what kind of parameters we want to set on what our trigger is for where we want to direct our paving to. I'm not sure if that's been utilized to its full extent in the past there. So something we'll be looking at in the future. With road construction, there's also the opportunity for extensive maintenance to be done rather than road construction. That's where I would like to look at bringing some of the shoulder pull program back into play with the county. I think it's really your best bang for the buck when you look at what we're putting forward with manpower and equipment based on what it costs per mile, even if we do it internally or contract it out. To recrown that road, to get the water off, to cut the curbs off, it really benefits the road. And I mean, yeah, road construction is nice for extending the ditches and making it little bit wider planning for paving in the future, but I think if we can seriously look at our shoulder pulling program coming back, I think that'll alleviate a lot of the problems we have with road concerns and that sort of thing. So yeah, some future challenges with all this is because we'll be looking at road construction, maybe not evenly spread across the divisions, there will be some discrepancies between lower density, lower intense divisions getting less miles of road construction or paving. Just something for council to understand and consider. And as always, the challenge with this is that we don't have a lot of future budget set aside for this sort of thing. So with all the projects we're talking about today, a lot of that hasn't been allocated for the future. So it's something council either has to look at debenturing or setting aside, or even talk with Bill, like loaning, getting loans on this kind of stuff. So all the kinds of things that I think aren't decided right now, but council could have a discussion about if that's where they want to put their priorities forward. I guess there's some other projects that may lead into the strategic planning discussions. Are this asset management project that we're bringing forward really will define a lot of what we do with future to capital replacements, looking at the work order systems for ratepayer responses and that sort of thing. We are going to look, all the departments are really moving towards a paperless system where we can eliminate a lot of the extensive staff time needed for going through these things. The programs we have, especially this asset management one, will do that immediately along the way. So just something I threw in here with the cap levy potential. I'm not sure if council has considered that in the past, but it's so basically it's community aggregate payment levy. So you are able to levy back fees on private gravel pits within the county here. Those fees are based on a tonnage of what they bring out to their pits, and that money, other municipalities do use that money for road maintenance for the roads surrounding those pits. So just something that council may consider during their strategic planning discussions. And then looking at the road use agreement, for right now we have road use agreements. They're primarily for the energy district. This is something that council could consider with not just limiting it to energy, but to all intensive hauls. A bit of a controversial subject for sure, so it's something I think that needs a lot of discussion through council to see if that's the route that they are willing to have. But it really comes back to a user pay system. If the road is being damaged by a certain user, that user should be responsible for the repair and maintenance of that road. So that's our presentation. So just some things for council to consider as you're going into the strategic planning session here is John talked a little bit about with the hamlet plans and that sort of thing, but really what level of support and incentivizing that council wants to put on some of the repairs that may be needed. I mean, we can go to two different extents in the hamlets. You could do what the reports are stating, which is millions of dollars in repair and replacement, or we can look at some middle ground on maintenance programs that will extend it, like John already has since that 2015 plan. There's been a lot of work done in the hamlets that you'll hear about more at the next planning session, but basically seeing where council's, what extent you actually want to go into with repair and replacement of that. Talking about the rural water, just some things for council to consider is what responsibility do you feel you have for supplying rural residents with that potable water? I know it's been done in the past, but we're in a new situation now with tax funds and that sort of thing. So something that council should consider. There's no obligation by any means for council to supply potable water to rural residents. So it is on what you feel that your level of responsibility should or could be. And then the same goes with the reconstruction of the road. Just kind of seeing what level you want. We can do multi-million dollars a year, or we can look more to a maintenance program that will extend out a lot of these roads. So just some things that council consider.
Councilors have any questions for Mr. Zier or Mr. Conklin? Okay, Counselor McGee.
I got to have a supper meeting with our group with our Minister for Environment, Minister Nixon, and he was talking about the fact that he has led the way with red tape reduction and that road construction specifically should see great changes in it. Have you experienced anything that's particularly notable at this time? And also, is there anything you'd like to see us advocate for being an emphasis on how the red tape works?
Yeah, so definitely through the chair, there has been from the regulations that Environment has placed on working within right-of-ways in existing developed road right-of-ways. From what they brought in 2017, or actually started enforcing, it's been quite a bit greater, reduced timelines, a lot more work, a lot more collaboration between the department and the municipalities. That's been good. I think it may start to be waning off on there. They got a lot of pressure from all of a lot of backlash, I should say, from a lot of the municipalities on the extended timelines for approvals for environment, that sort of thing. So they've cut back a lot of that. I think just if we talk about lobbying, that is something we just want to make sure that we enforce. It's getting better, but it still could be better, kind of thing. So, yeah.
Counselor Forbes.
Two questions. One would be, because we get updates on the bridge construction, like how, on a percentage-wise, how many have you repaired?
Ooh, percentage-wise, I'm not too sure. The most recent ones that we've been doing are bridge deck replacements. The wooden bridge decks, they get beat up, and especially in the area we're in, they have a lot of heavy traffic, and they don't last quite as long. And so we've been doing them in the warm weather when we got all the grader guys around and can do it in-house. But percentage-wise, the bridge repairs, I'm not too sure. Kind of depends on what ones they inspect per year and stuff. And
Okay. The other thing is about the shoulder pull program, which I think is a really great idea. Do you have the manpower and the equipment to do that in-house?
So through the chair, we haven't done that analysis yet.
Okay.
I'm feeling like we don't. I'm feeling like it would be, if we went to that level of full-time crew, that, I mean, if we really don't want to talk too many numbers today, but if we look at with our last few contracts, it has been, I think, around the $19,000 to $20,000 per mile on that. So quite expensive. Like, we were spending upwards of $1 million in a program per year to do this. So I think with bringing in our own equipment, bringing on our staff, it would not take that many years to pay off that contractor rate on those. So it's definitely something as we get into the analysis of this. Like I say, this still nothing has been budgeted for this either, right? So it's something to consider for the 23 season, definitely. But I think just looking at the numbers right now, it makes sense for in-house.
Counselor Cunningham.
Just to follow up on that, Councillor Phillips' shoulder pull question, how do you base, like, what's the factors to decide to do a shoulder pull on a road? Like, I heard you say, like, it's beneficial for the water to come off. Like, I'm just wondering, there's a road that was done, I want to say recently, but time flies in my division, and people have not been happy with it. So
okay.
I'm just wondering what the benefits to doing it are.
Yeah, and I think through the chair for the answer to that, I mean, it's a lot of different parameters. It's the width of the road, it's the crown if the road has been inverted by any means and the water is sitting on there. That's already a really good candidate for recrowning the road and allowing the water to shut off. If there's substantial curbs on the side, what a good thing about the shoulder pull, it actually does retrieve a lot of the gravel that's been pulled off the shoulder of the road. Excuse me. So all these things I would say would play into the factor for which roads we would decide would best benefit from that.
I guess I'll throw in a comment with that one. The shoulder pull program worked well. What it did is it brought some of these really wide roads back into condition. And it also saved quite a bit on the regraveling side of it because you didn't spend that 450 tons a mile of gravel, you could get away with 250 or 300 or whatever. It was a good program as far as I was concerned, but there was comments about the road being too narrow, but it didn't take long, and pretty soon the road got wide again. Okay, Councillor Penner.
Ladies first. Both of these are nothing to do with the county. Like, two complaints out of Swalwell are, why can't you do the Swalwell Road? I have residents go, plowing of snow, of course I'm talking about here in the winter right now. I have residents go from Swalwell up the dirt along the old 21 to the Linden Road because it's cleaned so much quicker than the Swalwell Road, but it's not our road, so we can't do it. They don't understand that. But the number one complaint I'm getting right now is the 575 Carbon East. It's not our road again. It's a provincial road, but they want to know what we can do as a municipality because it's in terrible, terrible shape. And it's been like that for a while from when they redid the number 9 highway, but they want to know whether Kneehill County is advocating to get it done sooner than later because there is no survey pegs out there or anything possibly for the coming year. So they're both not our concern, but our ratepayers are. That's what I'm hearing from them.
Yeah, and through the chair, you're exactly right. They are provincial jurisdictions, so we can get it down a slippery slope if we start getting deep into looking at maintenance contracts with that. The province is always open for the county to propose maintenance contracts for these kind of things. And I know I've gone down that path a few times here, and it's definitely dangerous ground. I think really your best bet is lobbying back to the province and to the transportation minister with requests on these. It may not go anywhere, but at least your voice is heard. We lobbied on a road for 15 years straight, and not a shovel was turned on it. So, but that was pushed every time. So, I think that's the best bet, right? Short of working into some kind of maintenance contract, which would be a dangerous road. So,
Councillor Christie.
I just commented on Laura Lee's negative comments on the road pull. I've had far more positive comments 2 years after a road pull's done than that first 6 to 8 months when it's done.
yeah.
Once it kind of settles, I've had nothing but positive comments after.
Deputy Reeve King.
You knew I was going to jump in on roads, did you not? So I know road shoulder pulls haven't necessarily been that popular in my division. I happen to be a relatively strong supporter of them. I like what they do. One of the biggest complaints always is when you shoulder pull a road, you put it back to what it's supposed to be in terms of top dimension. And people go, well, you narrowed it up and you've done a lot of things that make it harder to travel on. But the reality is the roads were never meant to be that wide, and you lose the crown, you lose the drainage, you lose all of those things. Shoulder pulls give us all that back. And it's just a matter of, I think, time, and people become accustomed to the new proper width. So you won't have a problem from me on shoulder pulls, you will have a problem from many of my divisional residents. One of my concerns always has been sort of the identification of deficiencies within the road network and who has the responsibility for identifying and bringing those to the attention of the transportation department. And I kind of firmly believe that's the transportation department's responsibility. And so I guess I have questions around the role of the supervisors and you know, in terms of what they're doing within our network and how they're helping identify and resolve issues within that. So I would be really interested in seeing something coming forward in the future to really help us to identify what those roles are, what it really looks like in terms of a rotation as far as the graders are concerned. I know we've talked about 6 times as a target, and I realize it's not always possible to achieve that. And I also realize that not every road needs a grader 6 times a year. So I'm happy to hear some of that conversation around thinking about how we go about that pattern. Do we grade all the roads 6 times a year, or do we look at the high traffic ones? So those things are really interesting to me, and I really am looking forward to hearing things coming forward in those areas. So I do appreciate the roads we have, and I do appreciate the grading and the snow clearing and all the things that happen out there. So I'm a strong supporter of your department. Don't ever take it that way, but you will hear lots from me about roads, so thank you.
Good. Any other questions from council? Well, thank you very much. Keep up the good work. From what I hear, everybody seems to be it's been a great year. So appreciate all the work you guys do. Okay, where are we at now? Oh. Christine. Welcome.
Good morning, Council. I have today just some things to kind of spark some conversation and provide some opportunities ahead of your strategic planning. So in communications, our current environment, and this is just a brief kind of summary, we've got our 4 ratepayer newsletters that we do every year. We have our weekly full-page ad in the Three Hills Capital. We have constant council coverage, so we've got the digital agendas on the website, live tweeting of the meetings, and that goes to Facebook and Twitter. The follow-up briefing and the council notes, and then we live stream on YouTube and we timestamp those videos, and we've just introduced the cow within the last little while as well. We have 2 discovery fairs and ratepayer evenings budgeted for the year, and we also are very active on social media, Instagram, Twitter, and Facebook. So some of the plans and documents, we've got our citizen satisfaction survey, and I know that Mike talked about that quite a bit at the cow meeting last week. So I won't really get into that too much, except for to say that we can probably build on a lot of the information that we received from that survey. We heard a certain percentage didn't think they were being communicated with enough, so maybe we can go back to that and say, well, what are we missing? What else would you like to see from us? We could also maybe give some thought to how often council would like to do that survey going forward, just to give it enough time so we can affect some change, but when should we revisit that again? And then the other plans and policies are in place there to guide us, and we can always look at redoing those as well, if needed. So just some future opportunities. We're always striving to improve our communications for our ratepayers. We'd like to approach communications strategically for each one of our departments and analyze issue-specific communications opportunities and efficiencies. And kind of going back to basics, just to ensure that we're reaching all of our residents and stakeholders with current relevant information as efficiently as possible. I think it's always a good idea to reevaluate any communications plan because the landscape changes so quickly. Audience profiles, an opportunity for direct mail, text, direct notifications for residents affected by water disruptions, line breaks, road closures, etc. We do have the capability on our website to set up a notification system, but it's just not something we've looked into yet. So there's that opportunity. And as part of each department's strategy, we could look into doing some how-to, some more informational videos, podcasts, et cetera, anything that will help get that message out there. We also can introduce the e-news bulletin, which council is familiar with. I brought that last year, I believe, as an example. And then website improvements to increase user-friendliness. This is definitely something I think that we could look at. And we had mentioned possibly even doing a focus group with some ratepayers. And maybe even just teaching computer website how-tos for residents that maybe aren't comfortable with the internet and our website. That might be a good opportunity there. So whenever we talk communications, we also talk engagement. And I know everybody, we always want to be improving on that, but what does that look like for council? I think that'd be something good to look at in strategic planning. Is that just identifying opportunities for feedback prior to decisions being made? And something I could definitely improve on as well is clearly communicating how council's decisions were influenced by the feedback and how feedback was incorporated into that decision. I think residents would like to hear that more, and that's something I can beef up. Definitely to be evaluating those communications plans. Is there more opportunity for ratepayers to have their concerns addressed and maybe some better follow-up? Like as of right now, we have a report of concern form on the website. You know, can we make that more robust? Do we want to bring back the coffee with council that we used to do? Those kind of opportunities as well. And then always some more increased transparency, and council's already touched on this before, just opening up the budget deliberations more and the strategic planning. And as part of that, there's also youth engagement, just getting kind of the young people involved in the municipality, and what would council's vision be for that as we go forward? So our future challenges, really the biggest one is resources. Communications is only one full-time position. And depending on council's vision, we may need to add additional part-time, full-time staff to complete those new initiatives. And we do have the opportunity to hire contractors outside if we want to do more engagement. You know, we can hire private companies. And then a big one too is quality rural internet for all the ratepayers, especially if we want to be kind of promoting our website as the hub of all of our information. If they don't have internet, then that won't work for them. Yeah, so that's it in a nutshell. Do you have any questions for me?
Does council have any questions for Ms. Anderson? Yeah, your department, i.e. you,
Yeah.
get a lot of things done, and we appreciate that, so.
Thank you, my pleasure.
It's tough to make us look good, but thank you.
It's not that tough.
Well, I guess you're off the hook, Christine.
Okay, thank you.
So is that it for the strat planning presentations? Yes, it is. All righty. It's council's wish. Councilor Penner.
I make the motion that council receive for information the strategic planning presentations as presented. Thank you, everybody.
Yes, thank you. So we have a motion before us to receive for information as presented. Is there any discussion to that motion? I see none. Call the question. All those in favor? And that is carried unanimously. All righty, our next agenda item is disposition of delegate and public hearing business. The ambulance operations. Ms. Crossfield, maybe Ms. Watt. No, all righty.
So you want to do council and committee reports while waiting?
All righty. Let's move on to council and committee reports. We have one, Community Futures, or maybe we have two. I can't remember how many I saw there. Any questions?
Just a comment.
Comment, please.
In our council, what do you call it, correspondence, they had this poster that Wendy sent up on the Mastering Recovery Project. So I don't know if you've seen it, but I had Carolyn bring it up for the screen. So besides running their triple RF program this year, they did this program, more than exceeded their targets and had huge response. One of the main things was to pivot small business onto Wi-Fi, what do you call it, presence, so that when people were doing online marketing and stuff, local showed up. So anybody that was involved there were really positive. The mental health part of this has been really strongly used. I mean, when you look at their targets, they were looking for 60 and got well over 100. So, and that was end of the year and it's still growing. They're gonna run out of funding the end of March, but it's been a really, really positive program that's had a pretty big impact in our community. So this was in our county correspondence, so I didn't put it in my report, but I brought it up from here, so.
Any questions?
That I can't answer.
Don't say that yet. If not, we have a motion that could be made. Councillor Christie.
I'll move the county committee reports as presented.
All righty, we have a motion to receive for information council and committee reports as presented. All those in favor? And that is carried unanimously. Thank you very much. Ms. Grosfield, we're at disposition of delegate business, the ambulance operations, and anytime you're ready.
Thank you, Reeve and council. Just to kind of wrap up the disposition from the delegation that we heard earlier from the ambulance operations and medical first responder. So the recommended motion is that council send a letter of concern to the Minister of Health regarding Kneehill County's concern with the length of time for ambulance services in rural Alberta. I believe that's kind of what you were looking for. But again, that's just a recommended motion. Relevant legislation, provincial emergency medical services are a provincial responsibility. Council, bylaw, and policy. Our fire department does provide medical first responses under our standard operating guidelines, again, which are being reviewed. Background ambulance concern. The ambulance service has experienced strains in the last couple of years, and it's impacting wait times in our rural areas. The towns and villages within our area have lobbied to the provincial government, supporting the need for better ambulance in rural areas. The province announced recently to change some changes to combat those issues, and that's what the presentation was on. Medical first responder. So in November 2015, council approved levels 1 and 2, which is standard first aid and first medical responder for Torrington's fire level of service for medical first responses under the MFR program. So council made that motion in council. Torrington Fire is dispatched to Delta and Echo calls only. These may result in CPR or advanced first aid unless an ambulance requests for further assistance. So during COVID, we have been requested to some Alpha, Bravo, Charlie, and those are like lift assists or first aid, needing help or family support, because fire departments do that as well, support the families that are around at the scenes. And so that's just on a request from the ambulance service. If they're too far away, they will sometimes request fire to those calls as well. All fire departments within our area are part of the medical first responder program, and fire departments may be restocked with AHS supplies on scene and reimburse for those supplies. They also offer some training as well. Financial and staffing implications, no financial implications to write that letter of support in principle regarding the ambulance service, and staffing requirement for administrative MFR paperwork to be completed by the Torrington Fire Chief, the Deputy Torrington Fire Chief, and the Rural Fire Chief, just to kind of keep on top of that. So council's options, you could send a letter of concern to the Minister of Health regarding Kneehill County's concern with the length of time for ambulance services in rural Alberta that council receives for information as presented regarding the ambulance services and the MFR program, or that council directs administration to bring back further options.
Are there any questions from council for Ms. Grosfield? Do appreciate the delegation that came before us, answered a lot of questions. Maybe not the right answers, but we did get answers. What's council's wish here? Councillor Cunningham.
I would make the motion that council send a letter of concern to the Minister of Health regarding Kneehill County's concerns with the length of response time for ambulance services in rural Alberta.
Okay, we have a motion before us. to send a letter of concern to the Minister of Health about ambulance service in our area. Is there any discussion to that motion? Councillor McGee.
Do we have examples of where it really has been a huge concern, or have we always been handled appropriately?
Through the Reeve, there have been some recently that they've been doing CPR for 45 minutes.
Thank you.
So there have been some absolute delays in the service this past couple of years for sure. And again, it's a multitude of factors that affect that. For the most part though, I think it has been fairly good.
Appreciate that. I don't want to advocate for something if we don't have something to fall back on to justify that advocation. So thank you.
Is there any other discussion to the motion? I see none. I'll call the question. All those in favor? And that is carried unanimously. All righty, we have one more thing on the agenda, council follow-up action list. Any questions, concerns? Kudos? Oh, Councillor McGee.
I move that we receive for information the council follow-up action list as presented.
Okay, thank you very much. We have a motion to receive for information as presented. Is there any discussion to that motion? I see none. Call the question. All those in favor? And that is carried unanimously. Alrighty, I do believe lunch has arrived. So we will break for lunch and then come back after for our closed session. Mr. Hogan, there was some emails that were transferred around this afternoon.
Yeah, just a very quick question for council, with your indulgence, of course, is every year leading up to RMA, we get the traditional invites. Do you want to meet with so-and-so or this department? Yeah.
Yep.
Do you want to meet with, whether it's the Department of Municipal Affairs or Transportation? We get one from K Division every year, which is the RCMP command in Alberta. So that email has come in, and we're just asking if council has any desire for us to request a meeting with K Division. Administratively, we don't have anything on the agenda that to elevate to that level. Generally, these are for things that you can't deal with at a local level. So they're not interested in meeting with K Division, the Sol Gen, et cetera, for something that you'd be talking with your local detachment commander about. Administratively, we don't have anything to elevate to that level, at least as a recommendation from ourselves. So if council has something, we can request a meeting, and if you don't, we can reply that thank you for the invite.
Anyone have anything? Okay, so I guess we'll send back a letter. Well, I guess we don't even have, yeah, we should probably send back a letter just stating we have nothing.
Yeah, I think if council were just, if somebody, if we had a formal motion that, you know.
Decline the invitation?
Yeah.
Okay. Anyone want to step out on that limb?
Oh, okay.
Councillor Folt.
I'll make a motion that we send back a letter declining coming to meet with them.
All right, thank you very much. We have a motion to decline the invitation with K Division at the RMA conference. Is there any discussion to that motion? Seeing as not, all those in favor? Carried unanimously. All righty, we have one item for closed session. It's under FOIP 17, harmful to personal and private information. Yes, Councillor Christie?
I'll move us into closed session to deal with FOIP.
All righty. Just about made it to the end of the meeting. Back on. All right, bring us back into session. We voted to come back out of closed session at 1:21. It is now 1:23, and I will adjourn the meeting. Thank you.